Good morning, ladies and gentlemen. Okay, I think that we are ready to start. So, ladies and gentlemen, dear guests, it is my pleasure to welcome you to Krakow, the second largest city in Poland, which was the capital of our country until 1795. In this beautiful city, we have the honor of hosting you within the walls of the second campus of the Jagiellonian University, the oldest Polish university, and at the same time, one of the oldest universities in the world. It was founded in 1364. Today, in the Auditorium Maximum building, we welcome you to the conference of the Polish Presidency in Health, promoting and protecting the mental health of children and adolescents in the digital era. I would like to welcome in particular of the representatives of the government administration from EU countries, as well as from Poland, the European Commission representatives, representatives of international organizations, non-governmental organizations, policymakers, representatives of the world of science, medical professionals, students, and above all, representatives of the young generation whose mental health well-being will be the main topic of today's debates, lectures, and inspiring speeches. I would like also to welcome the rectors and their representatives from medical universities, national consultants, representatives of the diplomatic corps, units subordinate and supervised by the Ministry of Health, and all of you interested in the subject of mental health of children and young people, also watching us online, also watching us during the online broadcast. During today's event, dedicated to one of the three priorities of the Polish presidency in health, which is the mental health of children and young people, we would like to invite you to participate in inspiring panels and thematic sessions. Details of today's agenda are available in the program attached to the conference materials. Now, let me present some organizational information to help you navigate today's plan. After the first part of meeting, which is held here in this room, around 12:20, we will invite you to a coffee break available on the second floor where we are currently. Please note that during the conference, during the coffee break, presentation of short videos on mental health prepared by Polish NGOs will be presented. And also, information stands of NGOs involved in the protection of the mental health of children and adolescents will be available on the ground floor. After the break, I will invite you to participate in parallel sessions. We are planning 3 parallel meetings, which will take place in the rooms on the 2nd floor. Session A, dedicated to the topic From Theory to Practice, promoting mental health of children and adolescents in the digital age, presentation of good practices and sharing experiences at Wystawowa Room. We are here now. Session B, vulnerable groups in the digital age, strategies for supporting and promoting mental health at Seminaryna Room. And session C, digital hygiene and opportunities provided by technologies, use of new technologies in diagnostic, therapy and prevention at Konferencyjna Room. Each of you can choose a thematic session you want to participate in. You will find the room designations and the session topics on the sign spots. At around 2:20, we will invite you to lunch served on the floor, on the 1st floor. I would like to draw your attention to the fact that during the lunch break, the comprehensive look at WHO's policy brief on digital determinants of youth mental health will be presented in this room as well as streamed online. After lunch, I invite you to participate in the summary session, which will again take place in the Wystawowa Room when we are currently. Please be informed that you can move between floors using the stairs or use one of the 2 elevators. I remind you that our conference is broadcast online. The broadcast is available on the Ministry of Health YouTube channel. Parallel sessions are also streamlined, each at the separate transmission. We will plan also the question and answer sessions. So I think that after that, we are ready to start the funnest, the most interesting and exciting part of our meeting. So I invite Minister Wojciech Konieczny, Secretary of State in the Ministry of Health, Senator of the Republic of Poland, to the stage.
Distinguished guests, on behalf of Minister of Health of the Republic of Poland, Mrs. Izabela Leszczyna, I have the honor to welcome you to today's conference. I am truly pleased to have the opportunity to address this extremely important topic concerning mental health of children and adolescents in the context of digital technologies. Health security issues have taken on special importance. We must unite our efforts to provide support of healthcare for all those affected by the war. In this context, it is particularly important to pay attention to the mental health of children and adolescents. The Ministry of Health is basing its activities on 3 priorities during the presidency: prevention and health promotion, mental health of children and adolescents, and digital transformation of healthcare. We launched our activities within the framework of these priorities in Warsaw on January 16, 2025, at the high-level conference Together for the Health of Europe, Strategic Directions and Actions of the Public Health Sector, where we addressed issues related to prevention and health promotion, as well as the mental health of children and adolescents. A high-level conference entitled European Health Data Space, Unlocking Europe's Health, was held in Brussels on March 18 organized in cooperation with the European Commission. During the conference, the benefits and challenges of implementing the provisions of the European Health Data Space (EHDS) regulation were discussed. Milestones in the implementation of the regulation were presented, along with plans and expectations on the EHDS. Participants discussed specific cases of future application of the new regulation and the tangible benefits for various stakeholders, including patients and research institutions. Then, on March 25, we continued our initiatives at the Informal Council of the EU Health Ministers. During this important meeting, we exchanged knowledge, experiences, and ideas for further activities in the field of mental health of children and adolescents, as well as prevention and health promotion. I would like to emphasize that during the meeting, many voices were raised in support of the measures we have taken as the presidency. This is extremely important for us, as it shows that initiatives related to the mental health of young are much appreciated and supported at the highest level on EU countries, as well as by the European Commission and international organizations. Such a report gives us the motivation to continue our work and reassures us that we are on the right path to improving the mental health of children and adolescents. We plan to use the results of these discussions in further work, including on the EU Council conclusions on the mental health of children and young people in the digital age. In order to listen to the opinions of those most affected, we have also decided to include young people in our meetings and activities, as their voice is extremely important. The opinion of children and young people and their perspective are crucial in creating effective and appropriate solutions suited for the needs. We are extremely pleased to be able to work with such young and highly committed individuals. Today's event is especially important for us, as it closes a series of key meetings on our priorities. It is an excellent opportunity to share experiences and summarize our activities to date. I would like to emphasize that the mental health of children and adolescents is one of the top priorities of Ministry of Health. Our goal is to create a safe and supportive environment in which every child and young person can fully develop their potential. The mental health of young people is a growing concern worldwide. With the rapid growth of digital technologies, children and teenagers are spending more and more time online. While these technologies offer many benefits, like educational resources and social connections, they also pose challenges to mental health. The responsibility for facing these challenges and creating a safe and healthy environment for young generation largely rests on adults. In Poland, we have clearly noticed the impact of digital technologies after the COVID-19 pandemic. The restrictions introduced to ensure the safety of our society have also had negative consequences. After the period of enforced lockdown and online schooling, it became evident that, for many people, returning to the offline world is a significant challenge. In 2022, Polish Ministry of Health initiated a pilot program to treat children and adolescents addicted to new technologies. This program will conclude in June this year, and the finding will be implemented into the healthcare system. The impact for digital technologies is a new challenge for all EU member states. While this is not a challenge that emerged yesterday compared to alcohol and drugs, which have been damaging people's mental health for hundreds of years, it is a new problem we must address. It is crucial to find a balance between the benefits of digital technologies and their possible risks. The aim of today's conference is to explore the available research as well as European solutions and strategies to support the mental health of young people. It is also part of ongoing discussion among EU member states regarding the Council conclusions on this issue. The conclusions proposed by the Polish presidency will address future actions to be implemented by member states and the European Commission. I believe that by fostering the collaborative approach among policymakers, NGOs, healthcare professionals, and youth, we can create a safer and more supportive digital environment for our younger generations. I wish you all an enriching conference, and I hope that today's meeting will lead not only to fruitful discussions, but also will bring new ideas for joint action. Thank you very much, and welcome in Krakow.
Thank you, Minister. And now we will hear a video message from EU Commissioner for Health and Animal Welfare, Mr. Oliver Varhelyi. Let's start.
Dear colleagues, ladies and gentlemen, many thanks to the Polish presidency for organizing this important conference. Your focus is vital and urgent. Digitalization offers many opportunities, but also major challenges, especially for children and young. Digital tools and social media can certainly help us connect, learn, communicate, and be creative. But they can also have severe adverse effects. We are all aware of the many dangers lurking online, from cyberbullying and hate speech to aggressive marketing and digitally enhanced images, not to mention the physical impact of the excessive screen time. Data from the World Health Organization's Europe office suggests that more than 1 in 5 adolescents play video games for at least 4 hours a day. If a child spends 4 hours in front of a screen and 8 hours at school, what time does he leave for family or sport? We need to ensure a safer and healthier digital space for children and young people. Intervention from an early age is very important before problems have a chance to take hold. This means providing children and young people with the skills to navigate the internet and social media safely. We had good discussions on those issues with EU health ministers on the 25th of March in Warsaw. The Council is working on conclusions on promoting and protecting the mental health of children and adolescents in the digital era. Against this background, I expect today's conference to provide important insights into the impact of social media, in particular the link to both mental and physical health. We need to work together to address these challenges. Here, you can count on the full support of the Commission. For our part, the Commission will carry out an EU-wide inquiry on the impact of social media on mental health, with a focus on young people. Moreover, many Commission services are already working on supporting children and adolescents in the online world, because this issue spans across different sectors. We will continue to work like this, as set out in our comprehensive approach to mental health, a key part of the European Health Union. Let me recall, we are already allocating nearly 1.3 billion euros in funding opportunities to support member states and stakeholders in improving mental health across policy areas. Out of the 20 flagship initiatives under this approach, several address children's mental health. Take, for instance, the prevention toolkit on physical and mental health, which we are developing with UNICEF. It will provide guidance for member states and policymakers on how to improve children's health, including their mental health, and it will be available next year. Another flagship is the Healthy Screens, Healthy Youth initiative, which aims to better protect children in the digital world. If we want to make a difference, we need to work together with all public and private stakeholders, including industry and digital businesses. It is time to talk with the platforms so they take their responsibilities seriously and work together with us. This is the only way we can ensure the highest safety and privacy standards. In parallel, we need to ensure that young people themselves take an active part in shaping our solutions, because this is their world, their future, and their choices. Thank you, and wish you fruitful discussions.
Thank you. Now I will invite you to listen the introductory speeches. First of all, let me invite to the stage Ms. Natasha Azoparty-Muscat, Director, Country Health Policies and Systems, WHO Regional Office for Europe, to present the intervention addressing the digital determinants of youth mental health, presentation of WHO Europe Evidence Review, Policy Brief and Priority Policy Actions.
Good morning. Thank you very much for inviting WHO to be part of this event. And I would like to start by acknowledging the leadership of Minister Lashina, as well as the deputy ministers who had the foresight to really put this topic on the agenda, as well as, of course, the European Commissioner. We heard the statement from the Commissioner Várhelyi himself, as well as Antonio Parente. We have been working very closely with them, and my colleague, Dr. Nino Berzuli, the WHO representative here in Poland. When in October we decided to work on this jointly together, of course the topic was already really at the top of the agenda. But even in 6 months, I'm sure you will agree with me, that it has continued to gain momentum and to galvanize more attention and concerns from policymakers, parents, and young people themselves worldwide. And you heard the Commissioner himself refer to the fact that mental health and well-being of adolescents, findings from our health behavior in school children survey, show that this is in decline. What does it mean? We measure, for example, the well-being index, and out of a score of 100, on average, young girls score less than 50, and boys a little bit better at 62. And 1 in 4 of our girls across the region, aged 15, report being lonely. And of course, the world is going through several upheavals since the COVID pandemic, one after the other. But one of the topics that we have to bear in mind is the impact of the digital environment. And here we can see quite clearly that when it comes to problematic social media use, we have seen an increase over the past 5 to 7 years from 7% to 11%. And I would like to stress at the outset that this is not about prohibiting healthy use of technology, but it is about protecting from the harmful effects of that technology. You heard Commissioner Várhelyi himself refer to another important finding from our Health Behavior School Children survey, which is around, for example, the gaming behavior, with 1 out of 5 reporting spending more than 4 hours playing games. And we see again a gender difference over here, with girls being more affected by the problematic use of social media and boys then more the problematic use of gaming. And you can see that this is an issue that is really making the headlines across the region. And therefore, it comes as no surprise that member states are seeking guidance. Because, of course, we want to be based on the science. And at the same time, this is such a fast-moving area where there is evolution and uncertainty that we need also to ensure that we are really taking that science into account on a rolling basis and finding ways to deal immediately within the ongoing sphere of uncertainty. And in this sense, you will find in your bags an advance copy of the policy brief, which we worked with the close support also of our colleagues here in Poland. And allow me particularly to acknowledge the input of Dr. Depukat and Dr. Lewandowska, who have been part of the working group, and we are very grateful for your expert input. So what we have done is we have developed two pieces of work, and my colleague Cassie Redlish, who has been working, of course, under the leadership of Dr. Ledia Lazzari, our regional advisor for mental health, will be able to give you more details if you are interested on the actual methodology. But we carried out, with the support of colleagues from the DTH lab, and here I would like particularly to acknowledge the leadership of Professor Kickbush in this area, a scoping review, as well as a mapping of the policy actions. And let me come immediately to highlight some of the key evidence review findings. I think it will not come as a surprise that this is not straightforward, it's not clear-cut, it's complex, it's nuanced, and partly this is because of the heterogeneity that we see. We are talking about, when we talk about children and adolescents, is a 5-year-old the same as a 15-year-old? No. And then we talk about gender, we talk about countries, we talk about the needs of specific groups. And we see that it's a very mixed picture that is emerging. And we are only beginning now to be able also to understand better the duration of these symptoms and effects and behaviors. Is this a phase, or is it something that people are actually going to continue taking with them into their adult life? And so we are interested, of course, in understanding the impact across a range of outcomes, looking at outcomes that are serious, like depression, anxiety, addiction-like symptoms, suicide-like behaviors. But then also the impact on the more general psychological and emotional well-being, the way in which these young people are functioning with their peer groups, within their families. Without ignoring the fact that social media, for many young people, actually provides a sense of connection and belonging. And we see this even with gender minority youth. On the one hand, they say that these online spaces bring them together in a shared community, but on the other hand, some of them then do experience some of the most harmful effects. So we also need straight away to acknowledge that some young people appear to be more vulnerable than others. And this is then where the public health perspective and approach needs to come in. How do we find this balance between allowing those who can potentially gain from the benefits, continue to be allowed to do so, whilst protecting those who are most vulnerable and most at harm? And over here also, of course, there is this bi-directional relationship that we see, that young people who have a higher tendency to have pre-existing conditions, for example, are the ones then who are going to be most at risk. And in a nutshell, it will come as no surprise, like any other public health issue of concern, that we need to understand this in terms also of the socio-demographic factors, protective and risk, the own psychological and behavioral composition of the individuals, because people are different, and the household in which they are being raised to. And therefore, there is still much to be done. We have to break this down better. We need research that is more granular. Here my appeal to those who are involved in funding research, in determining research policy at national levels too, to ensure that this remains a key focus of research and that it is good research and that we bring the various centers together. And in this respect, as WHO, we have been very privileged to work with a number of experts from across many collaborating centers throughout the region. Coming now to some of the key findings from the policy mapping, which was actually conducted across 42 countries with an emphasis, of course, on countries within the European region and the EU. And we know that policy responses have varied widely and the objectives have been different. Some countries are really focusing on tackling addiction and problematic use. Others are focusing more on the content moderation, age restrictions, engaging with the digital platforms, as we heard Commissioner Varhelyi say, to tackle the addictive features, but also the let's not forget, the tried and tested public health tools like awareness campaigns, like literacy of health workers, of educators, of parents. These are some of the things that are perhaps non-controversial and that need to be done and can be done quickly. And of course, policymakers have highlighted several areas of concern. But what we have seen also, and here I was very glad to hear that Poland has been very much involving young people in this debate and discussion, because sometimes what we are seeing are knee-jerk reactions. Policymakers are under pressure. They are under pressure to act fast. And there isn't enough time to even involve young people. As WHO, through our Pan-European Mental Health Coalition, we have actually produced a toolkit on good practice in involving young people. And I'm sure my colleagues will be able to point you towards it if you would like to hear more about it. So the policy brief, of course, seeks to go, this is where we work as WHO, we try to harness the best of the science and take it into the political reality. And we have highlighted 8 priorities for policy action. I will briefly go through each one, and we would very much welcome your reflections, your feedback throughout the parallel sessions, the discussions throughout the day. So the first one is making this an explicit priority. Thank you, Poland, for doing so. And we know that subsequent presidencies have also committed to continue doing this. And here, allow me also to salute Ireland, with whom we are working very closely on the roadmap for digital health and well-being. And what does this mean? This means having a focal point, making someone responsible, having an action plan, dedicating some resources. Secondly, this is not a matter for the health sector alone. We have heard that the Commission is carrying out an inquiry, and of course as WHO we are very pleased to be of support as required. And it's clear, when I was with the regional director, Dr. Hans Kluge, in Brussels 2 weeks ago, that wherever we went, whoever we spoke to, this was one of the topics that people were asking about. Third, we need to develop the guidance. But this is not a one-time publication, of course. This is going to have to be, by its nature, living guidance, because otherwise the date we publish it, it's already going to be out of date. Science has always evolved, but I think this is a pace of change and evolution that we haven't witnessed before, and we need to find the right way to do it. And here we are working very closely also with our colleagues at headquarters, who are looking into this, going beyond the use of screen time itself to looking now more broadly at content, for example, algorithms, AI. Holding industry and commercial interests to account. This is not optional. It has to be part of the package. It's difficult, we know, particularly because public health is facing a backlash against regulation. We have to be honest about this. It's not only in this area, it's also in other areas, tobacco, alcohol, food. And so we have to be mindful, we have to be smart, we need to make sure that we are backed by evidence, but there is no way that we can avoid engaging with the platforms and trying to ensure that steps are taken to at least address those elements for which there is clear emerging evidence of harm, such as, for example, the algorithms that are used, the use of having the safety features installed by default. There are many things that can be done, and greater use of content and age restrictions. And of course, this is about also making the online space a safe space for young people, not only for their mental health, but also for violence, for sexual harassment, also for their physical health. As WHO, our colleagues in the non-communicable diseases team have issued an important publication saying the online environment is actually an unhealthy environment also when it comes to the marketing of unhealthy goods, such as foodstuffs. Besides the fact that the more time people are spending online, the less time they are engaging in physical activity and in in-person social connection. Of course, for this, we also need to train and build capacity in the health workforce. General practitioners, school nurses, psychologists, counselors, these are all people who are going to be interacting with children and adolescents, and this has to become part of our routine history-taking. Of course, it wasn't part of the routine history-taking 10, 15 years ago, but now, absolutely, it must be. And we talk about this also in our forthcoming child and adolescent strategy, which we are developing jointly with UNICEF, thank you, and we hope to take to our regional committee. This, of course, will be one of the topics that will have a key focus. And I spoke about the need to continue to invest in high-quality research. And finally, I will close with the time-honored public health measures, which we shouldn't forget about, which is to continue to invest in healthy alternatives, whether we are talking about leisure and sports activities, whether we are talking about green urban spaces, whether we are talking about supporting social and youth community networks in rural areas, in urban environments, for particularly vulnerable groups. Let's not forget the important role that this plays too. So I hope that with this I have given you some food for thought. My thanks again to everyone who enabled this work to be done in a short period of time.
Thank you very much, Natasha. And now I would like to invite Mr. Kaloyan Mitev, Behavioral Science Policy Analyst, Joint Research Center from European Commission, to present Youth in the Digital World, Behavioral Insights, Mental Health Challenges and Policy Solutions. Over to you.
Good morning, everyone. First of all, I would like to say thank you to the organizers for inviting me. The presentation or the topic that I will talk about is youth in the digital world, behavioral insights, mental health, and policy solutions. So I'm a part of the Joint Research Center at the European Commission. We are based actually in 6 different locations within the European Union. I'm part of the headquarters in Brussels, but actually our biggest site is in Italy, in Ispra, and we support policy making within the EU on very, very different topics, from nuclear energy to social sciences. And we are the biggest DG of the European Union. So as I said, I'm part of the EU Policy Lab, which is based in Brussels, and within the lab we have the Foresight team, our Design for Policy team, and our Behavioral Insights team, which I'm a part of. Just very briefly, these are my colleagues within the center, Competence Center on Behavioral Insights. As you can see, most of us have a background in economics, but there are a few of us who actually have a background in psychology. So what do we do at the CCBI? We conduct research, we do different experiments, literature reviews. We also provide expert assistance to other DGs, or for example, the Erasmus Plus program. And of course, we also do capacity building. So we provide trainings to policymakers on how they can apply behavioral insights in their work. Our team works in various different topics. So from climate to misinformation to disaster preparedness, AI, and of course, health. So very briefly here, I wanted to present one of the projects that we currently have on the topic of health. And so it's the dark side of digital. So we are currently collecting data in 6 European Union countries, where we are exploring the use of social media and the benefits as well as the drawbacks of social media for adolescents particularly. We're also part of a lighthouse project organized by the European Center for Disease Prevention and Control, which sheds more light on the application of social sciences into disease prevention. So we already heard from the speakers before me, but I wanted to iterate one more time why is the topic of today so important. Well, from a developmental psychology point of view, early childhood is one of the most critical periods when the brain and the emotional capacities of young people are very rapidly developing. And this is why positive face-to-face interactions are actually very, very important, as this is how children use to learn to manage their feelings and to build empathy. Then, of course, during childhood and adolescence, the brain is also highly plastic and still maturing. Which makes young people specifically impressionable to external influences. Because of these habits which are formed during this very critical developmental period, so for example, the constant phone checking late at night, or as we heard, spending hours and hours every day gaming, then they can have a very strong influence on the future behaviors and well-being of people when they transition from adolescence into early adulthood and later in life. Of course, we know that social media can have not only negative but also positive influences. Online interaction and supportive friends, they can boost confidence, but the negative experiences, as we heard, like cyberbullying, social comparison, feeling left out, are very, very crucial and detrimental. So during we are living in really a digital generation. We know that even from the day when babies are born, they are exposed to different screens, and as infants and children grow older, their screen time, of course, increases. Of course, during childhood and early childhood, their use tend to be more passive. However, during adolescence, we see that the screen time and the use of digital technologies becomes way more active. So just some figures here. So around 80% of European children between the ages of 9 to 16 go online every day. So mental health and digital technologies, just very quickly, we already heard about the behavioral and the developmental outcomes. The effects of digital technologies on anxiety levels, on life satisfaction, but of course they can also be effect on emotional and social well-being, as well as on physical health. So for example, sleep disturbances, which then subsequently can have negative effects on the well-being of young people as well. And as I said one more time, not all use, of course, is harmful. And now, why do we need EU-wide coordinated policies? Well, I would say they're not ideal, they are necessary, and this is why we are all here today. Harmonized policies mean that no matter where a child lives, they will have, where they live in the EU, they have certain baseline levels of protection, which is absolutely crucial. And then collective EU action has a lot more power than the actions of a single country, whether it's within the EU or worldwide. So this is why, of course, the European Union recently enacted the Digital Services Act. All of these can actually help us achieve what has kind of already been hinted at today. So to improve digital literacy and education, so implement comprehensive digital literacy programs for both children and adolescents, but then also it can give parents guidance and provide support for parents how to manage their children's screen time use from the start, because perhaps a lot of new parents might not have the right levels of awareness or might not have enough knowledge on the topic. Of course, it will also boost mental health support. So governments and healthcare systems should ensure that there is enough accessible counseling and treatment for youth-specific to these modern challenges. Of course, regulatory measures as well, together with promoting a healthy lifestyle. So how can we apply behavioral science for better policy? Well, at the heart of behavioral science is understanding or gaining a very deep understanding of human behavior. And this is where behavioral science come into play. So for example, focus on the psychology of decision making. Why do young people use technology the way that they do? What might encourage healthier habits, and how do young people actually respond to different policy measures? This is what behavioral science can be very, very useful in determining. And these are all key points which are around designing better policies. So behavioral science, the use of behavioral science can really help design better policies. Our team recently published a position paper on the topic of the application of behavioral science into policy making. So using behavioral science, we can, for example, identify why teens might ignore the screen time notifications that they get, or what kind of messaging about mental health resonates with them. And with that knowledge, policymakers can then design more effective regulations or programs. So essentially, our position paper argues that the real power of behavioral science is unlocked when it's integrated thoughtfully through the policy-making cycle. So from defining the problem to testing interventions to then evaluating the outcomes, rather than just what we sometimes at least used to see in the past, but maybe not so much anymore, was that behavioral science was kind of seen as an afterthought. It was seen as an element of fixing policies after they had already been developed. But the idea of our team is that behavioral science should be there from the start, because it can really help encourage, test different small-scale interventions before they're scaled up and rolled out throughout the EU. So just to give you an overview of where behavioral insights can be applied into the policy making, or how our team sees behavioral insights. So as I already said, it's from interventions all the way to changing the system. So just a few summary and reflections now at the end. So we need to make sure that the young people engage in a healthy digital consumption. So recognizing healthy digital development as a pan-European focus. Then, of course, implement behavioral science into the policy making process. So build policies which are based on and informed by research, and of course coordinate coordinate any resources in order to achieve EU-wide solutions. As it was already said at the beginning, people come from different backgrounds, different cultural and social norms. So these are all very, very important for building sustainable and EU-wide policies, specifically related not only to mental health, but to physical health and to other issues which we are all currently dealing with on a European level. And finally, here, if you're interested, on the left, if you want to subscribe to our biannual newsletter, which our team publishes with different reports that we are currently working on. And on the right is a QR code to our monthly seminar series, where we invite outside researchers to share their research projects and see how discuss how they might be useful for the application into EU-wide policies. So thank you so much again for the invitation, and I'm looking forward to a very interesting conference.
Thank you very much for these very inspirational speeches. Now let's start our high-level panel, which will be chaired by Ms. Anna Depukat, psychiatry specialist, member of the Mental Health Council from Poland. I would like to invite also the participants of this panel to the stage. Nino Berdzuli, WHO representative and head of the office in Poland, Special Envoy for Ukraine Emergency Response in refugee-receiving countries. Francesca Colombo, head of the Health Division, OECD. Belén González Callado, Commissioner on Mental Health of Spain. Antonio Parenti, Director for Public Health, Cancer and Health Security in the Directorate General of Health and Food Safety from DG Sante. Okay. Ms. Katarzyna Kacperczyk, Deputy Minister at the Ministry of Health. Olivia Wiesgel, Director General of the Public Health Agency of Sweden. And Ms. Nona Zicherman, Country Coordinator, UNICEF Refugee Response.
Thank you very much. And I'm really honored, and I have the privilege to moderate this panel. So after such a broad and comprehensive introduction, we do have a challenge, not just during our presidency, but also in front of European Union countries and other part of the world, actually. So as we've heard, it impacts all children and adolescents and young people. So at the beginning, I would like to discuss the lessons learned and how to overcome barriers in developing and implementing mental health strategies for children and young people in digital era. So looking at European member states' experience, I will start from our representatives from European member states countries. So first, Spain. Belén, what successful national strategies or policies have been implemented to protect or to strengthen health resilience in this context? But also, if not implemented, what would you suggest?
Hi, hello, thank you. Well, first of all, I'd like to welcome the police organizers, especially you, of this Congress, and to thank the Polish government for prioritizing mental health during its presidency. Thank you also for inviting us to take part of this important discussion. The Council conclusion on mental health adopted during the Spanish presidency in 2023 invited all member states to develop action plans or strategies with a multi-sectoral approach to mental health. These strategies should address not only the health sector, but also areas like employment, education, digitalization and artificial intelligence, culture, the environment and climate-related factors, among others. A key example of the Spanish government commitment in this creation is the creation of the Office of the Commissioner of Mental Health, what I lead. This office has been given a high rank in order to make these mental health policies possible, especially those involving multiple ministries, which require strong coordination and shared responsibilities. One of the main outcomes of this new office, which I have the honor to lead, is the National Mental Health Action Plan. For the first time, this plan places a strong focus on the mental health of children and young people. It also includes specific initiatives to protect perinatal mental health in order to prevent the development of mental health problems later in life. In addition, it guarantees the right of women with severe mental disorders to experience supported and fulfilling motherhood. These measures range from the creation of specialized mother-baby units to tailor-made family support programs. Regarding the digital environment and children, our government is developing a new law that combines corporate responsibility with clear public regulation and strong safeguards. It also ensures quick access to mental health services when needed. It also ensures companies that develop digital services and platforms must take responsibility for the safety, rights, and well-being of the users, especially children and young people. In addition, we already have a law on the protection of children and adolescents against violence that guarantees the right of minors to accurate information, including digital and media literacy. It also addresses risks such as cyberbullying and grooming. And these are some of the initiatives that the Spanish government is developing to put child protection at the center of this work. Thank you.
Thank you very much. So, Olivia, same to you. What about Sweden?
Thank you, and good morning, everyone. I think that Sweden has aligned its policies to what WHO Europe says. So we are covering all 8 areas. We have issued guidelines for both screen time and content, and we have worked together with children and adolescents. Over 200 young persons were involved in this work, of course together with parents and guardians, together with healthcare professionals, civil society stakeholders, and academia, of course. We have invested a lot in a systematic review and are still investing in research in this area. And these guidelines that we have issued, we are now implementing them during this year, and they are well known all over Sweden, as has actually fueled a debate around kitchen tables, in schools, everywhere. And also we are hoping for not fueling debate, increasing awareness, but also changing attitudes and also moving towards new normative frameworks. So you have to work collectively in order to change norms. The implementation work is, of course, quite tricky. The most trickiest question is what can we offer as an alternative to screen time? What are the offline activities that can be attractive for young persons? So we are working a lot in that end as well, point 8 in the WHO strategy, how we can increase the use or the access to cultural engagement, sports activities, outdoors activities, safe and active transportation, different physical and other spare time activities. And we are doing that together with the youth also. And we are trying also to invest with the social economical aspect, so that we are now giving more money to those families that are in need of money for them to invest in offline activities for children, culture and sports. So I would say that we were quite surprised in Sweden that this guideline landed so well and were so embraced by all the families, but also all the families said that we have to do this together, all areas, all sectors, and it has not to be, we have not to put all the responsibility on the families, but also work with the tech industry. We haven't mentioned that a lot, but if we could have adherence to Digital Services Act, that would mean a lot. It's still a new legislation, but it protects the child and in a good way. So supervision, of course, will be very important in the future. Thank you.
Thank you very much. So I will go to Mr. Kacperczyk as a member state as well, but also Poland is halfway through the presidency. So based on the experience of the Polish Ministry of Health and the work on the conclusions, in your opinion, what are the most important recommendations in this area that should be included in the conclusions being prepared?
Thank you very much for this question, and also thank you very much to all of you for joining us today for the meeting. the topic is extremely important, and we have been, I will start maybe with some personal reflection, because we have been working at the Ministry of Health with the presidency starting actually January 1st, 2024, meaning 1 year before the presidency actually has started. And then it was one of the most important topic we added to the agenda at this time, and we have consulted all of the member states, international institutions like a WHO, but also working closely with the European Commission and the Parliament. And truly at this time everybody has recognized it as a biggest challenge, not only in the terms of health and health resilience, but also as a biggest challenge to the future of our societies and also young generation, obviously. And with the time, I mean, we have been working on the priorities, and with the time we have also seen that the topic is not becoming less important, but quite the contrary, more important, right? So we have seen the discussions not only within the international organization, within the European institutions, but also within the member states. So many of them started issued guidelines, as we have already heard, calling or establishing institutions, plenipotentiary, advisory council, just to address this issue. And we have been also thinking about this priority both in a traditional way and recognizing its very untraditional nature. Because when we talk about the mental health, and we had a lot of discussion also with Minister Konieczny, our consultant Ola Lewandowska, expert like yourself, Dr. Depucat, and then we were thinking, all of us, that we know how to address the traditional mental health disorders. And now we have something which is completely untraditional, because it's caused by untraditional challenges and root causes. It's unprecedented in scope, unprecedented in scale. We are affected because we have heard that most of the young generations and also adults, so let's be honest, it's not only affecting the young generation, it's absolutely unprecedented, the challenges unprecedented in scale, and in addition, the root causes are changing fast. So it's something we cannot control, it's something we don't fully understand, and it requires also completely new approaches and completely new solutions. We don't know them so far, and we haven't developed it so far. We know how to treat people when they're already in need of treatment, but we don't know how to prevent it, how to identify it properly. And this is something that we have learned through gathering like today, but today with experts, with professionals, with member states, with institutions, because alone we cannot truly find any viable and long-lasting solution. We have also talked, and we have heard it I think in WHO policy brief, thank you very much again for preparing it, that we're lacking also when finding the solution, we also don't engage young generations, meaning those affected to the extent we should. And when we're talking about the conclusion and also about our presidency, I'm very proud that together with Ola Lewandowska, Ola, thank you very much for this, we were able to engage young generation. We have here the representatives of our young generation together with us. They have been with us during the informal meeting of the Ministers of Health. They have been working with us on the conclusion. So I was coordinating the preparing of the first draft of conclusions, and I was really, I wouldn't say surprised, positively surprised, how mature, how wise young people are when they're giving the suggestions which have been truly reflected in our conclusions. So girls, thank you very much to the entire team, to you for your engagement. I think it has been very refreshing, not only for us in Poland, but also for the member states. And I think maybe last reflection, we need, since everything is new and unprecedented, we need also a new approach, holistic and systemic approach, which will create or help us establish a mental health ecosystem which addresses preventing, early prevention, addressing the root causes. We have been talked a lot about how to prevent at the very early stage the access to the new technologies, to the social media. And I think during today's debate we will discuss what concrete actions we can take, what regulatory measures we can implement, and of course how to educate not only children and young people, how to educate the adults, how to educate the parents, how to educate us, because putting only ban on everything is not a solution. So we have to truly start for educating ourselves in the dialogue with the young generation, just that our responses will be truly what we need and will be accurate. Of course, we have been talking and excellent examples from Sweden on finding the alternative offline engagement, but this is the responsibility of this within this early prevention framework. And then the next phase is how to develop solutions when the young people are already in need of treatment, how to treat them. We know, and then you, Dr. De Pucat, Ola Lewandowska, and all the professionals, you know it better that it is also untraditional treatment we need in this case, and not only one-time treatment, but also I would say the post-monitoring and care, so that we don't. I heard recently a good example. So when we give the car to the car maker because we crash it or something, so it doesn't make sense when we take it back and use and crash again and again. So that's why we need this holistic approach, and we need also a framework which will include many stakeholders. Obviously, professionals, medical professionals, but also educators, regulatory professionals, ministries, not only in one country, but across a country. And we need also the young people engagement. What to say, this is a big challenge. We are very happy that we brought this topic to the European Union agenda, and we hope that the conclusions will give additional mandate to member states, to European institutions, especially European Commission, to tackle this issue and to put forward concrete action, because we need to act now.
Thank you very much. And before we'll go to the international scope and those organizations and colleagues, I'll go back to Belen about lessons learned, but also what have been the most significant barriers policymaker encounters in designing and enforcing these strategies? So what is your experience?
Thank you very much for this question. It's very interesting. I would say that one of the biggest challenges we face in how difficult it is to clearly and confidently identify the impact of digital devices on mental health, as we have seen before. We know that there's been a significant increase in diagnosis, in prescription, and self-reported mental health problems. but it's not easy to pinpoint the exact causes of this phenomenon, even within the digital environment itself. For example, we know that girls' mental health has deteriorated more than boys, even though both are experiencing the digital age. We believe that online content reproducing gender violence, already present in offline environments, that may be a key factor. Another problem we've encountered is that some diagnoses, such as anxiety, can be expression of non-specific everyday problems. This makes it difficult to know how much of the increase is due to the medicalization on young people's languages. We are concerned that difficulties once described in subjective or personal terms are now being labeled with clinical diagnosis. This can lead to what we call an iatrogenic epistemic phenomenon, that is, treating common life struggle, such as relationship conflict or academic pressure, as if they were clinical syndromes. That's why we need to promote a social determinants framework, especially for young people, to better understand and address the roots of their suffering. At the same time, we must be careful not to focus exclusively on digital environments and forget about other areas we already know contribute to mental distress in childhood. I'm talking about structural issues such as poverty, gender inequality, violence, discrimination, and social isolation. These are powerful factors that require complex policies and the cooperation of institutions and society as a whole. The fact that they are complex doesn't mean we should give up on tackling them. Of course, with the sudden increase in mental health problems and demand for services, mental health systems are now overwhelmed. We already had a shortage of human resources, and this has now worsened, affecting the quality of care, waiting times, and working conditions for professionals too.
Thank you. So, Olivia, how do you think, and on your perspective as a Sweden, so what is the most challenging barrier?
Challenging. Yeah, thank you for the question. It's important to address challenges as well. I think one challenge is that it's not constantly remind us, it's not about a ban of social media, it's about using social media in a balanced and healthy way. So that means that you have it's not white and black. How can you increase digital literacy, for example, as we mentioned here? Secondly, you have to differ between content and screen time. We have much more research that shows that content affects you in a more negatively way than that screen amount of excessive use affect you. So you have to address those in different ways to curate content and to reduce screen time if necessary. And of course, with 8 hours a day for adolescents is a lot of screen time. So a difficulty has also been that it crowds out so many activities in day-to-day life, like being with your family, with your friends, doing your homework, sports, cultural activity, etc. So how to find your way back, that's very difficult, into new day-to-day behavioral habits. One issue that's been specifically problematic in Sweden has been that so many families, because we have an adherence and a lot of children asking for this guidance, and parents as well, that has been that the fact that this guidelines or to try to reduce screen time, to curate content, leads to many conflicts within the family. So how to do this in a way where you are not in a constant conflict, how to do it stepwise, how to do it as in a partnership with your adolescents, to have a maybe common or a mutual analysis of what we are doing, where we are heading, etc. And to do it not as a dictator, but as a guidance, or in your parenting, both supporting, curious, with a curious engagement, and not condemning engagement. So conflict has been a big difficulty for us. Thank you.
Thank you very much. So next question will go to Antonio, because from a European Commission perspective, what steps can be taken to coordinate and enhance cross-border cooperation to protect young people from this unhealthy exposure, but also what steps should be taken to introduce such a active action to policies?
Well, first, thanks first of all for the invitation. Thanks to Poland for a very great leadership in this role, because it's incredibly important to have a discussion with the member states in the council and with the parliament in issues like this. They bring them to prominence, even if maybe the prominence is no longer needed, because it's clear that this is a topic of great importance. Well, the European Commission, you heard my commissioner at the beginning, is launching a debate, a very wide debate on the impact of social media, especially on youth. Especially, I think, is important because, as has been said before, this does not only affect the youth, but affect primarily youth, and youth is the children, is the future. It's a tautology, but it's important to maintain this because, indeed, it becomes important to not to forget that these youth are the human beings, the adults, the leadership of tomorrow. So it's their mental health becomes of incredible importance. What we need to do, what we want to do, is to create a healthy debate on how we can tackle those type of issues. And I stress healthy because it has been noticed before. We need to find a compromise between what is the positive use of technologies, of screen time, of children, young adults, and adults interacting in the social sphere, and what is the negative effects. So the idea is to have this discussion most likely in the course of 1 or 2 years, depending, because we will want to have a very serious discussion on this, and on that basis then launch a debate and try to see what are the type of measures that can be taken at European level, based on the experience that member states have had, in connection with activities carried out by the other international organizations. WHO is the first who comes to mind, but of course UNICEF is doing also a great job in all of this, and try to find, possibly at the point, depending on what is the result of this debate, some form of European guidelines or issues to be seen. I mean, we'll have to see what is the specific instrument that can be found, can be used at European level to then implement the result of this type of discussion. But it's clear that it has to be a balanced debate, and an expert debate is necessary before we launch into anything further.
Okay, thank you. So it was mentioned WHO, so to Nino right now, what do you think? What steps can be taken from the WHO perspective?
Thank you so much, first of all, for invitation and opportunity to speak this distinguished panel. First of all, let me and let all of us acknowledge that today is the World Health Day. And the theme of the World Health Day is the healthy beginning, hopeful future. And it is very nice coincidence that today we are reaffirming our commitment to safeguard health and the well-being of young people, children and the young people, and mental health and the digital determinants of mental health, of course, played a very important role in this well-being of children. Now back to your question. WHO Europe's mandate to drive evidence-based policy and coordination, of course, enables us, and we have taken the very important steps in this direction, building on the 2024 position paper on online harms and the policy brief that Dr. Muscat presented this morning. We will further work with the European Commission, with member states, with all our partners together to establish this normative and the technical guidance. But as Antonio said, I think it is the prerequisite, for this normative and the technical guidance is exactly this healthy debate, the balanced debate, between the different stakeholders, engaging, of course, youth, academia, the mental health experts, the industry. We also need to understand, the technical, the industry as well. But, we have to have the very careful, approach, to that, how we engage the industry in this discussion. And we are committed, of course, to develop, taking, our mandate, develop the principles for this unified and the common approach for the standards for digital mental health and the well-being. And we are hearing from the member states that there are many initiatives, many steps that the member states have taken forward to develop these standards. But there was a very clear call for action from the EU health ministers at the EU informal health ministers meeting for the EU-wide action. EU-wide action on the common standards, the unified standards, so that every child and adolescent, no matter where they are, whether it is in Krakow, in Warsaw, or in Lisbon, protected the same way. The other dimension that I want to mention also, the importance of promotion of the digital literacy and the resilience education. And this is something that the WHO has been working for a number of years. And we have heard this morning also the results from the health behavior of school-age children and the results from this study. And the study called for integration of digital literacy into the school education curricula. So we, as WHO Europe, are very committed to work with all stakeholders, and here the intersectoral collaboration is key with the ministries of education, with the civil society, with the parents, how to integrate the well-balanced, evidence-based digital literacy programs into the school education. So these are the dimensions that we should work further, and of course now building on a successful work of WHO mental health coalition, and in particular I want to emphasize the section on the child and adolescent mental health. We can further leverage this mechanism to have this debate, this healthy debate that Antonio was referring to on engaging different stakeholders to advocate for ethical design in digital platforms to minimize exactly these addictive features and the harmful content. Thank you.
Thank you very much. I will go back to you, Antonio, as you answered a bit to my second question that I was supposed to ask. So as a clinician, I will change it a bit. And I will ask you, because we all agree on so many topics and issues in this area, but how do you think, from your perspective, what's going to be the biggest challenge to actually accept the conclusions from the European Commission perspective?
Well, I hope that we have, as I said, an healthy debate, and therefore there's not going to be a challenge to accept those conclusions. I don't think it's going to be always very easy, because there will be different interests at stake. Some will see most likely this debate as being too negative on the industry. Some will see not as negative on the industry, for example. That's why I really, and I will stress once more, that we need to discuss in a lay format what we want to do, because what is at stake is indeed the mental well-being of the future generations. So I hope that we will not have a challenge at the end, not in terms of content, not in terms of the possible legal instrument that will follow. As I said, this is completely to be seen, to be discussed, and of course one also to remember And maybe this is one of the challenges, that health policy is primarily a member state competence in the current European context. So we often put forward best practices, communication, examples, but then it's for the member states to then implement. And we see sometimes, of course, a certain amount of differences in the way regulations or in the way ideas, best practices are implemented throughout the European Union. At the same time, we see an increased requests of member states to have a coordinated approach. So I remain extremely positive on the fact that and this is one of the issues where I think a coordinated approach is more necessary than ever, inter alia, because people travel. So they may be going one day in one country and the other time move to another countries, including for reason of work. So to have a minimum approach throughout the European Union, I think is going to be positive. So let me hope that we don't find any difficulties in our work forward. And I think that the debate that we're already having under the Polish presidency shows that there is a large consensus on the need to move forward in a fairly coordinated manner.
Thank you very much. As we have a representative of OECD with us, so Francesca, today you're launching a policy paper as well on the best practices to promote mental well-being in children. Can you tell us, like, the key messages from your work and from your own perspective?
Sure, thank you. Thank you very much for the opportunity to be here and for the leadership of Poland and also of the other member states here. And yes, we are launching a small policy brief, which is here. It's been put also in your package, on promoting good mental health in children and young adults. I'll focus first on some messages which are, for me, quite critical. The first one looking simply, if you want, at the trends. But also the realization of, like, do we really understand what's behind those trends? That, for me, it's a key gap that we need to address. I mean, if we look at the trends more broadly, we know that the mental health of young children has been declining. But it has been declining for a while, actually. It's like, for as long as we have the data, we have seen that it has gone down. Maybe perhaps partly is because data are improving, the quality of the data, and so we are perhaps surfacing things and trends maybe that were happening, and that's a positive, but it's quite worrying to see these declining trends. And that pre-existed COVID-19, of course. During COVID, we did have a spike in anxiety and depression, but even compared to pre-pandemic level, the anxiety depressions among young children is significantly higher, 20% higher. Another thing that really shocked me is to see that suicide is the second cause of death for young people and children. It's only the 11th or 12th cause of deaths when we're talking about the population at large. So we do really have an issues here. But I think what we are struggling is to understand what's really causing, in granular way, those trends. To what extent is increased use of digitalizations, social media, that we do see, societies are becoming more, digital, and so this is happening. People and young people do use more social media, they are more connected, they have the phone and so forth. But also there have been clearly other trends. There's been, COVID-19, an environment which is quite negative. I mean, it's talking about conflicts, climate change, you name it, you turn around, it's really quite negative. What we are struggling with is to understand where there is simply a correlation and where there is a causation. If you talk, for example, digital health use and mental health, there is some evidence of some correlation for some particular problematic use of problematic social media use or cyberbullying, which actually has been increasing. But for the rest, we are really still stuck with correlation, which does not help us when we want to move ahead with policies, particularly when we're talking to our digital counterparts, so the industry, but also policymakers in digital. And we do see that in OECD because we work with people in health, like where I am, but also those who work on well-being and those who work on digital. And they are, they say, yes, we recognize that at the tail, there is a problem. There are some really problematic use. There are those who are really heavy users of social media in a harmful way. There is the cyberbullying at the tail. But, you know, okay, we can do something. But is this really, show me the evidence that there is a problem. And I think that policy gap that we see, it's also linked to this data gap that we need to address. Much more granular understanding on the digital use by young children, including both active and passive, not just in terms of time that they stay online, but really the quality of the content and all these things that I think, Olivia, you were saying that you're doing. I think that's fundamental. So we need to address that data gap, but there are also policy gaps, and that came clearly from our work. I think it was mentioned, Natasha, by you at in the presentation, and the fact that digital is becoming really a determinant of health, and in both positive and negative way, still poorly understood. It's a policy gap. Some countries do it, others don't. It's something clearly that needs to be more fundamentally addressed. We still treat mental health response as something that needs to happen when the things are very bad. So really at the very problematic cases, much less in terms of promotion of mental health well-being and prevention, and the use of digital in positive way for addressing that. And I think in the intersectoral responses, although we do see, and some of the countries here, I mentioned some of their examples, but it is still quite difficult to work across sectors, partly because of the data gap in the causational, really understanding the causational effects, which is hindering us. So these are some of the, maybe broad things, but something that we need to keep on working on if we really want to make a positive change in this area.
Thank you very much. And to UNICEF, Nona, giving to the UNICEF the intersectoral role, actually, because it's so important perspective, and we're a bit lacking of a discussion, in this discussion, the education perspective and the efficient intervention in this area. How can it be best leverage the expertise yours to support the implementation and documented good practice in school setting?
Thanks very much for the question, and it's really an honor to be here and be invited with our esteemed partners, with Poland, who has always been such a champion for children's health and well-being, together with WHO, with whom we work very closely in the Euro region on child and adolescent health, including mental health, and of course with DG Sante. Our new 3-year partnership was referenced in the video message from the Commissioner, and we're very excited to begin that work. I think we've heard a lot of the disturbing statistics about the decline in children and adolescent mental health, and it is extremely worrying. If there is something positive in all this, it's that as UNICEF, and particularly since the pandemic, we've been hearing very loudly from young people the demand to focus here more. And there is still stigma, of course. Some people are ashamed to come forward and ask for support. But since the pandemic, in all of our consultations, all of our conversations, young people have been saying very clearly, adults, we need you in this space. We need you to do more for us and with us, and particularly in designing services that fit our needs. So this is super important in this space, that we have young people with us, and this is the approach that the Polish presidency has taken. Indeed, when it comes to intersectoral coordination, and more than coordination, I think we're talking about integration. And when we are in a environment where there are just not enough services to meet the increasing needs of children and young people, UNICEF is focusing on the improved integration of services across the health, education, but also the social services sector. And this triangle is really important. These integrated care models have been shown to improve outcomes, including better management of symptoms, improved academic performance, enhanced social functioning, and even better quality of life. So UNICEF's advice to governments is really to look at the operational frameworks for community-based mental health as regards children and adolescents. And these operational frameworks can help show governments how to engage with the actors in the health, social services, and education sectors to design, implement, and evaluate strategies that are more comprehensive and also sustainable. When it comes to the education system, rightly, there's been an increasing focus on mental health interventions in the school setting. This is right, this is necessary. There's a lot of conversations about anti-bullying programs, violence in schools. This is, of course, very, very important. We would urge, though, governments to go beyond and really look at system strengthening, particularly capacity building of teachers. Teachers are at the heart of this issue, and they have to be capacitated for early detection, referral, and intervention. We know also many governments are making increased investments to make psychological services available in schools. This is good, but we need to look at standardizing that offer, standardizing the quality for what is becoming available in the school system. And we also are going to need to be creative about it because the shortage of human resources that some of the colleagues mentioned is real also in the school system. So we're talking about reskilling, upskilling, perhaps education professionals. I want to spend a minute also on the social services sector because several of our speakers pointed out the fact that all children and young people are not equally vulnerable, and those that come from socially or economically marginalized backgrounds are actually more at risk for mental health challenges. And the social services is where we find those families. Families that are receiving social assistance because they are economically marginalized, children who are living in institutions, children who are in contact with the law. These are groups of children who are more at risk for mental health issues and where their families are even less equipped to go and find services for them, particularly if you have to look for private services. This is a sector where there's a lot of underinvestment. Social workers need our help. They need our training. They need our investments to be able to help them also identify and refer and source mental health interventions. And this is also a place where digital tools can help them work more efficiently. There's lots of innovation out there. There's lots of great examples in the EU space, but really let's look at these three sectors and balance the different aspects of the triangle.
Thank you very much. As we're really run out of our time, but still we see it's such a broad topic and really fruitful discussion. But I would like to ask you, Nino, because thank you very much, Nona. We've heard that high quality standards are needed in this area. There's so many tools, and if we're discussing the challenges and the threats, the high quality should be really mentioned here in this area. So from the WHO perspective, how can we actually scale up the digital mental health innovation across borders and make sure they are high quality?
Thank you so much. Yes, it was mentioned already that there are so many tools, so many innovations in this sphere, the AI tools, different digital tools. We need to have a robust framework to understand what is the quality product and what we actually are promoting for safe use of these mental health tools. And here I would like to mention literally 2 weeks ago we launched a very important product from WHO, is the quality standards for children and adolescent mental health, which actually presents the robust framework, for understanding, what are the standards, for these tools that have been used across the all member states, and promotes the safer use of these innovative tools, so both in person as well as in the digital context, in the digital setting. So this is the one of the important instruments that the member states can use in order to develop their national policies and the national standards for safe use of innovations in the mental health services. And the second point that I also want to make, that in terms of the cooperation, coordination, and the work at the European level across the European region, I want to emphasize our cooperation with the European Commission and under the project, they addressing the challenges for mental health in the EU, Iceland, and Norway. And these present the great platform, great mechanism for exchanging ideas, the sharing the good practices, but also synergizing between the European Commission comprehensive approach to mental health initiative and the WHO's European framework for action for mental health. So this is the platform where we can further promote the quality standards for the children and the young people mental health, including in the digital settings.
Thank you very much. So Yeah, of course. Yeah.
Many thanks. Just a small add-ups to what Nina was just saying. In Europe, actually, we are in a fairly safe environment in that sense, because between the European Health Data Space and the AI Act, we have a system which can foster innovation, but can also take care of the rights of the people. So we can, and I want to underline this because sometimes these regulations are criticized as being particularly cumbersome. There are certainly some difficulties in the daily implementation, but what they're aiming at is granting to the citizen the trust on the use of certain platforms. And this, especially for the data that are related to health, is extremely important, because we can rely on the respect of the patients, the citizens' data, and at the same time do research on that basis. And therefore, we do have a regulatory framework that should, in the future, allow a bigger trust in also the type of responses that we can provide and we can design together in this area.
Okay, thank you very much. And as we run out of time, to Mr. Kacperczyk, just to conclude, in your opinion, what is the biggest challenge that we will have to face, as you've heard, to actually effectively implement the developed recommendations?
I wanted to finish with a positive message, which is not so easy, but one positive thing is when we proposed the conclusions, all the member states were very supporting, and I think we won't, in the sense, we won't have any challenge with the recommendations and mandate we try to include into conclusions. But one other aspect, so when we talk to member states, to experts, to professionals, everybody is on board. So we think that we will be able to very soon to prepare strategies, legislations which will protect young generations and ourselves from threats being in, online in the digital world. But let us not be misled. It won't be an easy issue. And when we talk about dialogue or regulating digital platforms, we have to keep in mind this is a huge industry. They're not only digital platforms, they're like producers of smartphones, tablets, all this. So it won't be easy and it won't happen overnight. So we should be clear. And while listening to the discussion, I took the parallel between what we are talking, the health sector in the digital era and smoking also. So we have been told for years, oh, we should concentrate on prevention, on promotion, on education, on information sharing, on of adverse consequences of smoking. And what we see? We have new novelty tobacco products, right? So we have to keep in mind, we will be always, the industry will be always a step ahead of us. So with new algorithms, with infinitive scrolling, so it's terrifying, with new technology, artificial intelligence. So we need to build really very responsible dialogue with the industry, with digital platforms, with digital company, just to, in a sense of responsibility for the future of actually not only health of the future generations, but also of the very existence of our society. So the shared responsibilities we should act with all stakeholders is very important. On the other hand, one positive issue. I've been working for over 20 years with European Commission and European Union agenda. And the positive thing is that Commission and the European institutions are not acting very fast and over time, because this is the very nature and specificity of the European Union. We have 27 member states. We have, there are a lot of interests, societies. But I know once we start with something, so I think that's why the conclusions will be the stimulus. It is like a snowball. It won't stop, right? So having on board UNICEF, WHO, OECD, obviously European Commission, I know that it's a positive way we will move forward, and this is a good news. And the last point, what we also want to achieve through our presidency. And this is a little bit broader topic, which includes the mental health of children and young generation in the digital era. We have to think about the health in a strategic way. Health should be priority not only in health and in DG Sante. It should be priority through the all sectorial policies. And then if we think about it in the more comprehensive way, I think we will achieve a lot of more. So again, thank you very much to all of you for contributing to our priorities, to moving this issue of the agenda, where we have been talking with Minister Konieczny that our efforts to advance this topic, to find solution, will not end up with our presidency. So again, thanks a lot for all your support we have been giving during the last months in preparing this priority for the EU agenda.
Thank you very much.
Thank you very much for this very fruitful and interesting panel. I think that we are all inspired. Now we will move to the session dedicated to risk and protective factors supporting the development of children and adolescents in the context of new technologies. That is why I would like to invite to the stage Ms. Marta Pociłowska-Szylman from Institute of Digital Citizenship to present digital hygiene as condition for physical, mental and social health during childhood and adolescence. Over to you.
Hello and good morning or early afternoon. My name is Marta Pociłowska-Szylman and I'm here on behalf of the Institute for Citizenship, for Digital Citizenship Foundation. And I will have a slightly different approach as I work in an NGO sector. And I would like to share with you how we operate and how we work on digital hygiene and digital citizenship. And the truth is that we tackle mental health and well-being, but what is very central for us is the health in general, because we understand digital hygiene as health protective behaviors and digital citizenship as creating a space, a digital space that will be safe for all of us. And the very beginning of everything that we do at the foundation is that we strongly believe that if we want to change something in young people, we have to start with ourselves. And saying ourselves, I mean each and every one of us. Because probably you know the feeling when your phone is discharged and you can't approach your bank account, on when you can't order a taxi, or you can't shop, or you can't get in touch with your kids. So this is about them, but this is overall about us and how we act and how we shape our everyday behavior. And if we look at adults and then we think what adults do and how they introduce children and young people into the cyber world, into the digital world. We have areas where we have already some options and we know how to do it and how we should proceed. For example, when children go to school, we tell them who will be the teacher, that they will have some colleagues in there. We show them the building. We tell them what are the rules that they will have to obey. Meanwhile, when we give them the mobile phone, many times we say nothing. And then we have children with no regulations in places that are not designed for them, because internet is made by adults and it's made for adults. This is why we decided that we would like to see whether the big tech oligarchs that are saying that children are not online and they won't count them, because their regulations said that they are forbidden to use communicators in social media, so they are not protecting their rights because children are not there. They are. And we've decided to make a coalition of adults with other institutions and asked our friends from Polish Internet Research and Gemius to give us the data that is the data for advertising industry and publishers. And what they do is they install spying software on the computers of the users, and they can tell you exactly what is the activity online of the people, among them children. As you can see, the age gap is between 7 and 12. So we have 1.4 million children using online platforms and using communicators, places where they shouldn't be, really, and where their rights are not protected at all, because the owners and the creators, the big tech, is telling you that they are not there because they are forbidden from being there, like they are not allowed. But they are there, and they are using social media platforms and experiencing everything that is there, that is, as I said, designed and created for the adult world. So this is what we did, because we thought it's very, very important to say that we can count those children and we can show it. But it's not about the children, as I said, but it's about us. So we made the research on how do we act online and what we do online. And this research that we did is based on a survey, that is a survey for adult Polish citizens. And this is a survey that is investigating our digital hygiene. And digital hygiene, as I said, are health protecting behaviors in our everyday life. And we discovered that 40% of adults believe they overuse their mobile phone. Now imagine those kids that are using their screen time, overusing their screen time, coming back home and seeing their parents acting like this. Seeing their grandparents many times also using internet in not a healthy way. And only 15% of adults respond when they see something being insulted, harassed, or bullied online. So if we want to raise a healthy generation that knows how to use internet and how to use their mobile phones, how to use electronic devices, then maybe we should first look at ourselves. We saw this already today, and this is an article that is saying that mobile ban in schools is not improving grades or behavior, and it's true. Because in the debate that we are having right now, that is going all over Europe, and we can see that many countries are trying to do something about mobile phones, that this is not enough. Because in our study that we made, the first one, the Internet of Children, we could see that the children, even if they can't use their mobile phones at school, they are coming back home, and at 5 o'clock in the afternoon, until midnight, their activity is very, very high. So this education of adults as an element of changing the ecosystem that the children are living on an everyday basis is crucial. So what we do in our foundation, we are trying to approach the subject from a very personal way, maybe a little bit like the climate change movements do, using the active hope approach, that we all know that it's bad, but we should try to find a way to act. but also on the level of institutions and schools. We work with schools, but also public debate. And our research shows also that it's very, very important to involve the big media, traditional media, newspapers, televisions, because this is how people get to know. This is how we had the smoking example here. The shift can be done, but it's, of course, if we include all the elements that have been mentioned, and I will talk about them. So what we're trying to do, if we are trying to do it on the individual level, on the conscious personal use, then to build a conscious society through formal and informal education, and then through systemic solutions and responsible economy, legislation, effective enforcement, changes in education, and responsible digitalization. And this is in the heart of what we do. This is the definition that we use. And it's good because it enables you to act. Because it says that health protective behaviors related to the use of information and communication technologies, especially internet and screen devices, this is digital hygiene. So this is something that you can do. It won't change everything because the big tech is very strong. Internet is indeed, especially for children, a place that they can encounter a lot of harmful and difficult content. But this is something you can do to protect yourself, and you can teach the kids how to do it. And if we then look at the definition, we split it in 4. So the first element is setting boundaries and control. So this is the screen time. This is the control over the screen time, limiting your contact with the screens, and concentrating on current activities. So this is the screen itself. Then content, so what's inside, creating and receiving content, doing it responsibly, verifying and reacting, something that we don't do. If we don't do it as adult people, how the young people are able to do it, if we don't give them the example how to act. Then safe use, the sharing the personal data and protecting against malware and data theft. This is something that is normally, if you think about digital hygiene, you would go there. This is the easiest answer, but something that is also quite well covered, even though the artificial intelligence now is trying to, it's used to steal our data in new ways, that's for sure. But we can see that the safe use of internet understood as the element number 2 is important not only for us, but also for the banks. So the education is not only coming from us, but it's also coming from the industry. And thanks to that, we know more in here that we are able to do here or there. And then other healthy behaviors that we normally don't connect, or we don't easily connect with digital hygiene. That is the quality of sleep. Do we scroll before going to bed? How long? Are we able to stop? Are we able to take our phone out of the bedroom, which is for many people not even possible? We even forgot that we discovered alarm clocks, and it was many years ago. And we don't have to keep our phones with ourselves all the time. Mindful eating. How many of you eat with the screen? That's also to me. So using the screen devices, why we should share the meal with other people, or we should concentrate on eating. This is a very important thing, especially in very young children that are being shown, for example, YouTube short movies to make them eat whatever, and how does influence their development. Protection against infections. This is cleaning your phone, body position, physical activity, hearing protection, building relationships, handling stress and emotion, and being safe on the road. So all of those is health. And all of those is digital hygiene, because all of those elements are protecting our health if we want to feel good, if we want to have good health, but especially if we want to teach our children how to use their electronic devices. And that's why the answer is not easy, and we've been talking about that since the very beginning. It's very, very complex. That's why I showed you also those 3 levels on which we try to operate. But at the same time, I strongly believe that this ecosystem can be changed if we start with ourselves. And how we operate in our foundation, trying to do a shift in a narrative about how we use our screen devices. So we do our research, the National Digital Hygiene Survey. This is something that we do every 2 years, and we are trying to investigate whether something has changed in the perception of devices among adult Polish citizens. We have a tool that is available on our website, and we will have it in English by June. So if you want, you can check it. I will give you the QR code at the end. And this is a tool that we designed with the Medical University of Warsaw. So it's really a tool that you can use, and it's an educational tool. It's going through the 4 areas of digital hygiene. So you can check on yourself, but you can learn at the very same time, and you can take it many times so you can see also the progress that you have made. And the Internet of Children. So we are trying to show the adults and what we do, but at the same time, we are trying to really show that Internet is a space created by adults and for adults, and especially in the context of saying that social media platforms are social media. It's like it's a grassroots movement, you know. It's like something that we create. Or well, we don't, because it is a digital product, and our data, our content, everything that we put in there, it's being used and monetized. Teaching. So we go directly to schools, and we have free online digital hygiene lessons. You can download them and you can do it in your school if you want to. But this is for us especially important, because we really feel that school is the heart of the change. This is the place when you can really approach the parent, something that is very difficult with educational program, because parent is everyone and no one. And here at school, you have a child in the heart, and you have all the adults around. So it's difficult, and we know it. Teachers tell us that it's difficult to talk with parents and to change their approach, but maybe that's the only place then we can catch all of them and try to work with them. And especially because even if it's not working perfectly well, schools have tools to make a change, and they do it, and they invite us, and they ask, and they try. Even if they fail, they try again. So this is so important to make schools the heart of change and really support teachers and headmasters so they can do it better, and they can use their position as a community center for families when people gather around children that are important for everyone. We do it through activism, so we are there where we can influence systemic changes. We try to be in commissions, we try to participate in conferences, and we try to take the message and spread it and share it. And we are trying to change public debate, introducing the topic to the broad public discussion. And really, it's so important. And traditional media is so important. Even if we are being told that now it's all social media and it's very, you know, through little channels, and you have to publish on your Facebook or your Instagram account, that doesn't matter really, because if you want to go wide, you need to have big media outlets with you. And we really can see that it works. So even if we wake up in the morning and we are not very happy to go to another television station to sit down on the couch and tell about digital hygiene, we do it because we know it really works. And I won't give you simple answers on what to do. In the panel discussion, I will share some of our experiences, but I really believe that if you look at the definition and the 4 elements, then you can slowly work on your intuition. Because it depends, of course, who you are, where you work. Maybe you need your phone because a phone is an element of your everyday work and you really need it. So you can't compare screen time of one person to screen time of another person. The places that you visit, the content that you need. But you can have the intuition what is good and what is bad based on the 4 elements that have been more or less addressed in here, to see whether what you do is good for you. How do you feel? Does it affect your life? Do you have strong feelings about something? If so, check if it works for you. Maybe there is something wrong. And I think if there is 2 things that I would like to teach young children about digital hygiene: first, be in contact with yourself, and that something bothers you very strongly, probably there is something wrong. So that's the first thing. But the second thing is that regulating your life with your phone is not about taking something away from you. It's giving you something back. Because you don't want the phone to decide about how you use it. You want to decide how you use your phone. What do you do there? How much time do you spend there? So if you talk to young people, I think this is a very good message to share. This is not about taking something away. We are not stealing anything. It's that you think that you decide, but there's so many mechanisms that have been mentioned here in the social media that you may think that it's you, but it's not. And you should be aware of that. And digital hygiene is a tool of active hope for me. It's giving you the hope back that you can do something. You won't change everything. It's bad. Internet is bad. The lack of regulation is bad, but you can have your path, and you should try to find it. And at the very end, to sum up, I would just go back to school and say that really looking about the discussion of mobile phones and seeing how actively schools are searching for solutions and how difficult for them is to find their place in the world where they have to fight with something that is shiny and colorful and fast and giving you constant pleasure, and this pleasure is coming like this. The schools are trying to find their way, and maybe they shouldn't compete. Because many times I hear from teachers, we have to compete with the online world. Maybe it's not about competing, maybe it's about asking ourselves a question, what school should be nowadays? And maybe the narrative about it should be about something different, that having to win the children over the internet. And all of us adults, we should think together what we can do to change it. So, 47 seconds for me left. This is our website. We are now working on the English resources. They will be in June online, all of them, including the big report on children online. So I invite you all. If you are Polish speaking, you can use them right now. And thank you very much. And I hope that we will somehow together, us adults, find a way in starting with ourselves. Thank you.
Thank you very much. Now I would like to give the floor to Ms. Zuzanna Jączyk, Hanna Kuźmitowicz and Julia Perlejewska, students of the high school number 3 in Gdynia, to present RAD 34, the impact of new technologies on the mental health of children and adolescents. The floor is yours.
RAD 34. Our lives are too precious to be left only in the hands of adults. Today, we know that technology impacts young people, yet not always positively. Issues such as stalking, hate, and exclusion are, I believe, very familiar to you. However, we wanted to propose our viewpoint from a completely different perspective. Chapter 1, Addictions. According to data published by the World Health Organization, more than 1 in every 10 of adolescents show signs of problematic social media use. This sharp increase since 2018 is very concerning. The average time spent online by European adolescents is so alarming that we decided to investigate the reasons behind it. Sites such as Facebook, Snapchat, or Instagram trigger the same neural circuits as gambling and drugs, leading to continuous user engagement. Studies have shown that likes, shares, and follows on these platforms activate the brain's reward system, which can easily lead to addiction. And today, for the first time in history, it would be more efficient to change the pupil's biochemistry. First president of Facebook said that the platform literally changes your relationship with society. From the very beginning, the thought behind building apps like Facebook was to capture users' attention and make them dependent on the app. And just between the 3rd and 20th minute of using TikTok, videos referring to death, suicide, and self-harm appear. And big corporations are fully aware of their actions. The apps are designed to be so intuitive that younger and younger users easily fall into their harmful trap. And one of them is romanticization, defined as giving an aesthetic appeal to negative and damaging phenomena. Social media glorifies unhealthy habits, toxic relationships, or self-destructive behaviors. This reality distortion profoundly impacts young users who absorb messages without grasping the consequences. And a well-known example of romanticization is Euphoria, a 2019 HBO series that depicts various teenage struggles, all played by stunning actors who even make opioid addiction looks appealing. So appealing, in fact, that teens started to throw Euphoria-themed parties, blinded by aesthetics and normalizing destructive behaviors, to the point of an almost 30% increase in suicide rates after the first release of a series 13 Reasons Why. And the obsession with aesthetics can also be seen on TikTok. Just take a look at the study results. 35% of the MDMA-related content has a positive tone. A trend-driven generation is increasingly reaching for substances after constant exposure to them on their For You page. Personalized drug-related hashtags make these videos easy to find, reaching thousands of views. And hashtags are also used to create communities, including those about eating disorders. Their content pushes unhealthy body standards, urging young people to weight less and eat less. And a former Meta expert claims that the company fails to remove harmful content related to suicide. Pop culture is overflowing with toxic patterns that turn harmful behavior into just another part of an aesthetic. So, ladies and gentlemen, let's ask ourselves, how are we supposed to behave in this flood of negative influences without fearing for our own well-being?
Chapter 2. Fear. Our generation is often labeled as the most anxious, with research showing higher stress levels than previous generations. But what truly distinguishes Gen Z is that the scope of our fear has changed. We no longer worry only about the fate of an individual, or at most our city or a country, but about the fate of the whole world. Our daily concerns now include epidemics, wars, and climate change, not just within our country, but on a global scale. With recent events, the topic of war has become extremely prevalent. The influence of media, which amplifies the spread of information, only adds fuel to the fire. The goal is to make us afraid, and this is a form of manipulation. The sheer number of articles claiming to predict the exact date of a Russian attack on Poland is surprisingly high. The internet and social media are used to selectively or systematically target individuals, groups, or large segments of society. The fear of a dystopian end of the world is not only presented to us through social media. We have been exposed to such imagery from an early age through, for example, pop culture. You have surely watched The Matrix, or perhaps you have heard of the film Ex Machina. However, the Netflix production Black Mirror serves as the perfect example. In the series, a character's contact lenses recorded his entire life, which was then used, for example, by airports to check for suspicious activities. In reality, as early as in 2014, a patent for smart lenses, contact lenses capable of recording what we see, taking photos, and displaying additional information in augmented reality was obtained. By blinking, they could connect to our smartphones. Additionally, smart lenses that provide access to the metaverse already exist. People say that this series is not science fiction. It is a reflection of the present. As I mentioned earlier, the boundary between the digital and the real world is becoming increasingly blurred. In front of you are two photographs, one of a real person and the other an AI-generated avatar. As you can see, it is very difficult to distinguish between the two, and most people we ask to do so fail. AI is developing at an exponential pace. Young people in particular fear that it will take over our future. Overstimulation is also one of the main issues we experience. We have everything, yet everything is far too much. Too much information, too many decisions to make. This is called the paradox of choice. While more options can increase our happiness, beyond a certain point, more choices actually reduce it. Why? We experience something called analytical paralysis, the feeling of being unable to make a decision due to overthinking the problem. What you might not be aware of is that young people fear phone calls, preferring texts or emails instead. What once was not a concern, children not contacting parents, has now reversed, with social media increasing anxiety for both young people and adults. You have created a world we are now afraid to leave. Even when we want to disconnect from social media, the fear of missing out prevails. We are trapped in a loop.
Chapter 3, Safety. We fear losing something by not engaging with social media. However, when we do, what we lose is our security. The European Commission estimates that by this year, the market value of all data processed online within the European Union will reach 829 billion euros. Our personal data has become the new oil to big corporations. One of them is Meta. Last year, CEO Mark Zuckerberg apologized to families of children who committed suicide due to use of his apps. Yet, this year, he announced the removal of fact-checkers in the US and possibly Europe, which is a retreat from any sane and safe approach to content moderation, causing exposure to harmful content. Another threat to family is sharenting, where children are exposed to constant pressure and judgment from others. Parents are not aware of their actions' impacts. The statistics speak for themselves. If that's not convincing enough, here's more. The average digital birth of children worldwide happens at about 6 months, and 15% of children begin their digital life before they are even born. Sharenting is so prevalent that in 2020, Polish YouTuber uploaded a video of her own childbirth, not covering the face of her newborn. Many parents, however, worried for their children's safety, use apps to track location and monitor smartphone use. While seemingly beneficial, these apps often include eavesdropping features, eroding trust and privacy. Children feel excessively controlled, with no personal space, even in their own room. Of course, we are not only controlled in our rooms. London has confirmed its first permanent installation of live facial recognition. The 2 cameras will be installed in the city centre in an effort to, as they claim, combat crime. Preventative groups have spoken out against this scheme. This constant surveillance disrupts personal boundaries. Boundaries are essential for maintaining comfort. But with the advancement of AI, they can be easily breached. According to Security Hero, 98% deepfake content online is used to create pornographic materials. Children can simply create this using apps designed to undress individuals, which do not confirm the real age of the user. Nowadays, there are many such victims. How are they supposed to build healthy relationships and trust someone afterward? The easy access to online porn contributes to high porn addictions, turning young people into both victims and offenders. 1 in 5 adolescents reported that their peers watch pornography several times a day. On average, children have their first exposure to this type of content at the age of 11. Seeing the state of the internet, we lose trust in others, causing deep relationships to slowly fade and making it harder to form new ones based on trust.
Chapter 4, Contact. Right next to us might be someone we could deeply connect with. Yet, we retreat into digital, shallow interactions. A cold, smooth, flat phone often seems more appealing to us. Teenagers experience a high level of loneliness on social media. And you are surely familiar with movies like Blade Runner or Her. These movies are no longer fiction. They are becoming our reality. With the rise of AI, chatbots like Replica have been created, allowing for the emergence of new type of relationships. A relationship with a chatbot. Eugenia Kujda developed it to continue conversations with her deceased friend. As she says, Replica is a companion in the truest sense of the word. The most supportive relationship you have ever experienced. Those applications certainly do not protect younger users. One victim is Sewell, a 14-year-old boy who became dangerously attached to a bot on a character AI. He created a sexual relationship and fell in love with the bot. On February 28, 2024, he took his life. Child-bot relationships are dangerous, as children's brains can't fully control impulses or grasp consequences. And the internet is our new playground. The metaverse is a digital, three-dimensional space where avatars let people work, socialize, and have fun. Though it might seem futuristic, 20.6 million Europeans enter it daily via a popular multiplayer game, Roblox. Players can shape the gameplay by creating objects, places, stories, relationships, and more. And companies have created virtual cities in the game, where players can buy digital versions of real items, including a virtual Gucci handbag costing around 500 euros. Ladies and gentlemen, 67% of players are children under the age of 16. I'm telling you this because companies are using it to introduce unaware children to the metaverse, blurring the line between virtual and real world. Social media, but not only them, trap us in informational bubbles. On TikTok, the effective personalization of algorithms shape and influence both individual and group beliefs. A person from one side of TikTok has no idea about the information that a person from the other side sees every day. In a cognitive war, the human mind becomes a battlefield. The goal is not to only change what people think, but how we think. And in 2016, Facebook's algorithm spread anti-Rohingya propaganda in Myanmar, amplifying hate content that fueled violence and ethnic cleansing. A UN mission found that algorithm played a determining role. The opponent can realistically conquer society without resorting to open force. We are more connected than ever in human history, yet we are also the most lonely.
Chapter 5, Experiment. Ladies and gentlemen, as much as the metaverse is still an experiment, we feel like one too. Orwell's world has reached the University of Michigan. In 2013, Charles Munger donated a windowless dorm building for over $100 million. Despite student complaints, the building is still in use. Some say it's an experiment in preparing young people for life in the said metaverse, where digital reality becomes their main source of interaction and stimulation. It is quite clear that the students do not support the idea, deeming their experiences horrible. It truly seems that young people have become the perfect objects for testing new technologies. A growing number of schools in China are equipped with AI cameras and brainwave trackers. The interesting part, the producers claim that those headbands measure students' focus with EEG technology, yet no one is actually able to pinpoint what it is that they track. Ladies and gentlemen, maybe you thought that you are safe because you are no longer students. Well, let me tell you that you might be wrong. Last year, a non-invasive method for mind reading was developed, also using EEG technology and, in short, analyzing brainwaves. It was done both for words and for images. Here on the left, you can see original stories and sentences shown to the test subjects, and on the right, those recreated by AI. And here, analogically, original at the top and generated at the bottom. As you can see, the system is not yet perfect, but who knows what will happen in the future. Additionally, with the help of facial analysis, AI is able to determine our political views, sexual orientation, or even faith with 92% accuracy. We don't know who is analyzing our data, and we don't know if it will be used against us. But this, again, is not the only way for them to gather and experiment on our data. Various features are already used for more in-depth evaluation. AI analyzes not only what we click, but also how we click, reaction time, context, and intensity, and then transfers this data into an image. This is a heat map from the Guardian website. What we clicked more often has visible, warmer colors, and what less, green. But maybe not only our thoughts, but also our actions are endangered. Optogenetics is a biological technique that uses light to control specific genetically modified cells. Researchers at Yale University did just that, genetically modified mice, which allowed them to switch their killer instinct off and on at will. And as they say themselves, turning the mice into stone-cold killers. However, AI and new technologies are not only used for negative purposes. Virtual reality therapy has already begun to be used as a form of treatment for mental illness. It enables the use of a computer's simulation of the real world as a therapeutic tool. It is particularly useful in exposure therapy, treating autism, and its effectiveness for PTSD therapy reaches 70%.
Rat 34. You are probably wondering why our presentation has this title. An experiment was conducted in which the digital rat was given a choice between food and pressing a lever. Pressing the lever stimulated the pleasure center in its brain. According to study results, the rat preferred pressing the lever, eventually stopping to it and function normally. However, I would like to highlight that this photograph comes from a different experiment, Mouse Utopia. Rat 34. A rat, because if you like test subjects, in an experiment conducted by adults, they have created unattainable yet alluring goals in the digital world for us, while constantly increasing the bar. Addiction engineers are hired to keep us glued to our phone screens. We have an impossible choice: disconnect from our relationships or remain immersed in the digital world, sacrificing real-life connections. The mental health decline in young people is the result of an uncontrolled experiment. But this experiment is no accident. It's cognitive warfare engineered by all those in power. Ladies and gentlemen, we leave you with only one question. Where does the war begin?
Our work for others is not just the presentation. For the past year, we have been developing and working on the 72 Hours project, which aims to build resilience among young people and society during the crisis. We are carrying out this project as a working team in collaboration with the Naval Academy and the Polish Psychologists Association. And we would like to thank Minister Katarzyna Kacperczyk for the invitation and trust. We are thrilled to contribute to the discussions upon the topic of mental health on young people. And we would also like to say that we are performing in a reduced squad, and Zuzanna Rudziks, who also worked upon this presentation, is our team member. We also thank our project coordinator, Mrs. Anna Rzepa, and Pani Ania Tymoszyk. Yeah. And we would also like to thank our former teammate Małgorzata Rutkowska and members of the project Cognitive Warfare Through the Eyes of Young People. Thank you so much for your attention.
Thank you. Thank you very much for this really moving presentation. You know, it wasn't the first time I seen this presentation, and still it is really, really moving for me and eye-opening as a mother, as an adult, and as a person who tried to be responsible for the future of our kids. So thank you again, girls. And now is... Now is the time for a coffee break, but just let me remind you that during this coffee break, you should choose the session you would like to participate and find a dedicated room. The signposts will show you the way. We will have 3 parallel sessions. And one more really important information, as we are a little bit late with the agenda, which of course it is due to extremely interesting discussions and extremely intensive lectures and debates, we will move our time schedule by 20 minutes. So still we will have 30 minutes, half an hour for the coffee break. And at 10 minutes past 1, we will start our parallel sessions. After the parallel sessions, there will be a lunch on the first floor, and we will start our third session, the third plenary session, after the lunch. And we will start at 3:30 here. So have a nice coffee break and very fruitful parallel sessions. See you.
One way to implement AOP programs
Perfect. So welcome to our session. We are teeny tiny late, but I think afterwards we have lunch, so we can also discuss questions or remarks during the lunchtime. Let me introduce myself. My name is Magdalena Rowicka, and I will be your host for the next 1 hour and a half. I'm a researcher, and I'm from Poland. I work at one of the universities in Warsaw, and I'm a psychologist. So I will try to restrain myself from typically psychological questions and comments, but I will give a summary of this session during the session afterwards, so after the lunchtime. The plan for today is that we will begin with something extremely important, because today we have a launch of 2 reports on mental health that are prepared by WHO and OECD. So we will take advantage of 2 of you, and we will ask you to provide us with further highlights from those reports. Then we will move a little bit more, or dive a little bit more into what digital diet is, that we've already heard before, and then we will follow through a couple of countries step by step. I will, of course, introduce by the names and the institutions each of you, but if you would like to add something, if you have any additional information on your slide, or you would like to say something, please do also introduce your institutions. So we will begin with WHO, here we go, with Lydia Lazari. That's correct? Lazari, okay, perfect. So please, the floor is yours for the highlights of the report.
Thank you, and thank you so much. Again, I reiterate my colleague, Dr. Natasza Azopardi-Muscat. Congratulations to the Polish presidency for highlighting this. This is an issue that has come more and more to hit us in interaction with member states, because it is clearly a concern that is also complicated by the fact that the advancement of technology goes far faster than any speed even the best systems are trying to catch up with. So in an unprecedented way, we are facing this situation where the dynamics of the concern at hand are so much faster than the best response we have been used to conceive. So that's why it's very much appreciated. And while I say that, I'm sure that there is even more advancement in those very minutes about new features in social media that are added to the use and to the impact. So if I can summarize the evidence, it's not easy, because what is very clear is that the evidence is nuanced and there is no black and white. And I think this is very important for all of us to see, because wherever we sit, either as public health workers, or as parents, or as advocates, we usually tend to take a partisan position. And the mainstream position until very recently has been that, oh, social media is all bad. Which one may argue that it might be bad, but what's important to know is also it's here to stay. It's here to stay, and the digital spaces are here to stay. And it is increasingly difficult for the parents, for public health experts, for all those who design policies and services. It is increasingly difficult to penetrate, to permeate the spaces where young people, adolescents and young people, increasingly live their lives. Until recently, we as parents, I'm now talking as a parent, no? Until recently, as a parent, you try to liaise and to partner with the typical stakeholders in a child life, the teacher, parents of their peers, other figures of authority, and the children peers. But then those have been disappearing in the digital sphere, and there are stakeholders in the digital sphere, certainly, but we are not aware of. And because this is here to stay, this is not an issue that we can ignore, which is why we try to see the evidence in a nuanced way and see what are also the benefits so that we can build upon those. And I would like to quote here a person, a young person from Portugal, with whom we at WHO Europe have been working as part of the group of young people, members of the Pan-European Mental Health Coalition. She's a person that lives with multiple disabilities, including autism. So she comes to one of our meetings and she says that you adults, she's about 20 years old, and she says, you the grown-ups talk about digital spaces as necessarily negative. But for a person like me, she says, I feel that that is the safe space I can operate and I can interact with other people without being judged and in the safest way. Which is indeed a refreshing perspective, because usually in my age and generation, I would have felt that it is necessarily bad. So that was an eye-opener. And this is what the evidence shows, that the social media use has a complex and multifaceted relationship with mental health and well-being. The second is that there is, of course, risk of harm. And there are a lot of examples. What is the risk of harm? We have alarming anecdotal evidence from some member states where there are young people, people as young as 13, 14, who are drawn into suicidal behavior because of social media, bets and challenges. It's anecdotal because that at least that experience that I'm referring to is not yet put into evidence, but the country is desperate to take action because they feel they are losing their young people. However, the evidence of impact is mixed and inconclusive because, as the evidence shows, some young people are more vulnerable than others when it comes to online harms. And I liked very much the presentation from our Polish colleague about the digital hygiene, because you made it very clear how there are a lot of indicators that would determine how a person builds their resilience vis-a-vis potential harms in the digital spaces. And certainly what we have found is that technology use carries greater risk for some people as opposed to some other people. And I don't think we have that time now for me to go into detail, but sufficient to say you can all go into the document that is in your bags. Just a reminder, it's not yet published. You'll see the document says draft, not for circulation, because we need to do the final editing, which is language editing. That's why you don't find it online, but you'll find it very soon. There are many factors that shape the relationship between young people, technologies use, and mental health outcomes. And certainly when it comes, this is related to the resilience of those young people. And as we all know, the mental health professionals know that resilience is determined by a number of factors, including, for instance, I'd like to draw attention here on what the famous survey, Adverse Childhood Experiences Survey, that focuses on a number of determinants in a young child life this having some predictability on how that child will be when they grow up. And certainly those factors will have a determining impact on the resilience of the given child vis-a-vis the harms of and the risks of social media. Another finding is that, or consideration is that social media design features impact young people's mental health in different ways to other technologies, because a lot of them are designed to be addictive, a lot of them are designed to be commercial, and therefore, unlike other online presence, the social media designs are having a very direct consequence on shaping someone's behaviors and attitudes vis-a-vis interactions, digital spaces, social interactions, and so on and so forth. So. The evidence is nuanced, it's here to stay, I mentioned that, and my last point is we cannot single-handedly address this, single-handedly either as public health professionals or as policymakers or as industry representatives or as young people alone or as parents alone. And what it's very clear in the exercise we're having is that we would certainly need to sit around the table, all of us. The policy recommendations, and we were talking a couple of months ago with Professor Kickbush about the need to strengthen the offline activities for younger people, no? And to not allow digital spaces to take over the entirety of young people's lives. And in that we need to be mindful, because then we need to design urban spaces that are fit for our children and young people, and so on and so forth. But beyond that, so in addition to that, we not only need to have the voice of public health professionals be heard very clearly around the table, not preventing that digital policymakers take the decisions alone. They cannot and they should not, because we are the ones that offer the evidence. But we need around the table parents, we need the young people themselves, and we, as importantly, need the industry representatives in order not to have a combative relationship with them, rather than have accountability relationship with them, making them accountable. And this is what one of the policy actions that WHO is putting forward in our policy brief. Thank you.
Thank you very much. And let's move to the second report.
So I'll go to
the report from OECD that will be, the highlights will be presented by Marion Devaux, Health Policy Analyst at the Health Division of the OECD. Thank you.
Thank you, Magdalena. Good morning, everyone. So it's a pleasure to be here. Thank you very much for this opportunity to present the work of the OECD on promoting good mental health in children and young people. So this work is part of a stream of work on best practice in public health that is co-funded by the European Commission. And the need for identifying and assessing best practice in public health stem from the observation that mental health of young people is poor and declining. There are several observations, several factors that show that mental health is declining. Here you can see, and we discussed a lot today, the data from the health behavior in school-based children that show reduction in mental health, with an increase of the proportion of young people with multiple health complaints, so both physical and mental health complaints. So today, in 2022, more than half of adolescents have multiple health complaints. Other indicators also show this pattern. So the prevalence of anxiety and depressive disorders has increased by 20% compared to pre-COVID levels. And suicide is the second cause of death in young people in Europe. And this has also long-term consequences, in particular lifetime mental health outcomes, but also educational and occupational outcomes. For instance, children with mental distress are about 20% less likely to achieve tertiary education. Another observation is that there are important policy gaps in all EU countries. So the data, I see it's not the latest version I sent, but it's fine. So the data from the WHO OECD mental health survey show that all countries have national mental health policy and strategy and action plan to guide the policy in primary healthcare settings, schools and workplaces. But the level of implementation vary widely across countries. So if we take the first bar here in the graph, so it relates to the implementation in primary healthcare, and we can see that 28% of countries do not address or have not yet implemented a mental health strategy in primary health care. Most countries have implementation underway, and only 10% have fully implemented it. And if we look at the implementation in schools, 21% of the surveyed countries have not addressed or have not yet implemented a mental health strategy in schools. The majority are implementation underway, and only 14% of the surveyed countries have fully implemented it. So to address this policy gap, the OECD has identified and assessed 11 candidate best practices to promote mental health and prevent mental ill health. The selection of these candidate best practices was made with the help of the European Commission portal for best practices and with the help of member countries of the OECD expert group of the economics of public health. So these 11 interventions are listed here. So first, on maternal health and infancy, Next Stop Mum from Poland aim to early diagnose postpartum depression in postnatal women, and it contributes to better outcomes for infants and children. Then there are 4 interventions related to schools and teaching staff. So this is me from Slovenia that combine a school-based program and an online support program. Hygiene from Finland that aim to accompany socially vulnerable children. DB's Friends, which is a program to enhance social-emotional skills in children, and it has been implemented in multiple countries. Mental health first aid, also implemented in multiple countries, that aim to train frontline workers, such as school teachers, social workers, to help to provide first aid to someone with mental distress or in a crisis. And then there are 4 interventions related to providing mental health support and care, in particular to people with mild and moderate symptoms of depression and anxiety. The prompt mental health care model from Norway, and the reform of the mental health system in Belgium, so aim to provide prompt and free access to psychological treatment. I Fight Depression is a web-based tool, self-help tool, guided by a mental health professional. It has been implemented first in Germany, and now it's scaled up in multiple EU countries. And the intervention At Ease from the Netherlands is a peer-based program that provides young people with access to walking centers to talk about their problems. And then 2 interventions related to suicide prevention Austria, and vigilance from France. So all these interventions have proven effectiveness in at least one of these 3 domains. So social and behavioral challenges have decreased by between 4% and 50% across the different case studies. Mental health symptoms and mental health disorder have decreased by between 10% and 87% compared to a control group, depending on the study, on the case study. And school and occupational outcomes have improved between 50% and 61%. So I propose to take 2 concrete examples of candidate best practices. So first, Hygiene. So as I said, it's a program to accompany socially vulnerable children and adolescents. It's developed in Finland. And it promotes social inclusion and mental well-being, and it has a strong focus on team sports. So team sports is really embedded in this program. So the evidence shows that it improves social behavior in half of participants 4 years after the implementation of the program, and it reduces by half the number of children not being in employment, education, and training. And this program is being transferred to other EU countries, so Denmark, Estonia, Slovenia, Spain, and Italy, through Hygiene Europe project, funded by EU. And the OECD analysis shows that the intervention Hygiene is highly or moderately transferable to OECD and EU countries included in the analysis. The other example is the IFD, I Fight Depression. So it's a web-based tool guided by a mental health professional, and it includes a specific dedicated version tailored to young people. And it is available in 16 languages across European countries. So the evidence shows a 40% reduction in the symptoms in people who receive the intervention compared to control groups, 6 weeks after the intervention and 3 months after the intervention, and 89% increase in quality of life. And this intervention has been transferred to Bulgaria, Estonia, Greece, Hungary, Ireland, Italy, Poland, and Spain through the EAAD BEST project, so led by the European Alliance Against Depression, funded by the European Commission. And the analysis show that, our analysis show that this intervention, I Fight Depression, is highly and moderately transferable to 80% of OECD and EU countries included in our analysis. And finally, this is my last slide. We have carried out further analysis to estimate the potential impact of transferring and scaling up this candidate best practice intervention across Europe. So these results have just been obtained. They are new, and they will be published in a forthcoming publication later this year. So we have modeled 4 interventions. These are listed here: I Fight Depression, Prompt Mental Health Care, Next Stop Mum, and Vigilance. And if EU countries were to transfer and scale up this intervention, they could avoid between 70,000 and 8 million cases of mental health disorders. They could save health expenditure ranging from 0.01 to 3.6 euros per person per year. With the intervention, people who are healthier and happier, they are more likely to be employed and to participate in the labor force and to be productive at work. And we estimate savings in labor market costs between 0.04 and 3.5 euros per person. And overall, these 4 interventions would be cost-effective if they were transferred to all EU countries, and some of them would be cost-saving depending on the country studied. So that's it for my presentation. Thank you very much for your attention.
Thank you. Thank you very much for both of those presentations. And what we can actually hear is that on one hand, there is not that much evidence showing causal relationship between using or even abusing the media and depression or other mental disorders. But on the other hand, it is extremely important to understand that we have raising numbers when it comes to depression and other disorders. So essentially, those very concrete examples of interventions would be working independently of the digitalization. And I think this is extremely, extremely important. We have a lot of evidence for them being effective and being implemented. So congratulations to those countries that already have them, and well, those who do not, please incorporate them as quickly as possible. Okay, thank you. So now I will ask Marta Puciłowska-Szylman from the Institute of Digital Citizenship to dig a little bit more into digital health that was already introduced a little bit before. So digital hygiene in action.
I will go through here, hopefully. Okay. If we can have the presentation on the screen. Oh, brilliant. Before I start, I have a few thoughts on what's been said before. And one of those things is that digital hygiene, as I told you before, is about behaviors. But I think it can be really a strong tool that you can use building resilience in young people. And that's how I understand it, really. Because if the element of resilience is fighting crisis, or it's the ability of going out of crisis and seeing that there is hope, then this can be quite useful. And the other thing I think is that creating offline possibilities for young people is crucial, and it's good to organize them, but it's very important to leave free space for young people to be organized by themselves. And this is something really missed nowadays. It's very difficult to go somewhere where you can do whatever you want and there is no adult telling you what you have to do. It's not about telling you that you will have this or other kind of exercises or workshops or whatever. You want to spend time with people like you and you want to decide about yourself. It's really a shrinking space nowadays. So it's all the time about structure, it's all the time about organizing stuff, and sometimes maybe it's to leave young people alone. This is just a thought. During my previous speech, I was telling you more or less how we act, and I was presenting you what is the definition of digital hygiene, and now I would like to deep dig a little bit how we understand it, and why we should teach people of all ages about digital hygiene. And the first point is learn to manage your screen time. And what's important in this first one is that really managing screen time itself is a very important tool, because the techno stress, this feeling that there is too much of everything, you don't need the research to feel it. And it's not only about internet, it's about the overwhelming presence of everything everywhere attacking you. It's about noise, it's about the sound, it's about the light, it's about the information. So digital hygiene is one of the elements, one of the tools that can help you fight it and can help you reduce the techno stress that is nowadays an element of everyday life of us and of our children. And there are some easy tips that you can take, which is the screen time for weekdays, weekends, trying not to carry the phone with you, very difficult at all times. If you just look into yourself and you ask yourself if you carry your phone everywhere at home, probably it is so. Then turn out the notifications, keeping the phone out of sight when you work or study, because you know the behavioral element is already there. So if the phone is on the table, even if you have no notifications, you will think about the things that you have inside of the phone, and same works with children. And introducing children to the digital world, parental control, screen time limits. And what we hear when we talk to students is that they really need it. And they're telling us when we use communicators, for example, WhatsApp or other type of communicators, we are there completely alone, because parents think that we talk at school about school subjects and everything is happening there. Help us regulate it. Tell us what we can do to have it moderated. You are what you look like. Choose games and online content that are safe and appropriate for your age. Engage with content that makes you feel good and avoid content that causes discomfort. And this is very important. When something is very strong and you have a very strong emotion, probably there is something wrong. Always have an adult that you can talk to. And it's good to have it always on your mind. Who is that person and who you will go to and talk to when something bad happens? And the very important thing about screen time and content together is tolerance. If you watch a lot of bad content, harmful content, then you just develop the tolerance, and then you just get used to it. And it doesn't matter whether it's offline or online. Like if you see a lot of pathos streams, for example, then it's very difficult to manage. Point number 3, take care of your safety. This is something that we are trying to do, all of us, especially us, shopping and having bank accounts online. One thing that I would like to underline is that taking care of your safety is also publishing stuff online about you. And this is something that schools do many times. They run their Facebook profiles, for example, or Instagram profiles, and they publish children's photographs. Why? They are not companies. There is no need to publish kids. They can just talk about education, and they don't really need to do that. But this is something that we developed, that we live online nowadays, and we have to compete with maybe companies that are selling stuff. So we also try to advertise ourselves even in places where maybe it's not necessary. Remember the impact on the body and mind. Do not use the screen device before bedtime. Try not to sleep with your phone. Try not to eat with your phone. Do you know that people tend not to have tables nowadays because they don't need them to sit together and eat? Find time for physical activity. Mind your posture. Try to find alternatives. Learn delayed gratification. Cultivate hobbies outside of screens. All of that is very easy and very difficult at the same time, but worth remembering that this is also an element of digital hygiene. And first the person, then the screen. This is basically the message. Every day find some time to talk to people, to meet people, to be in touch offline, because our brain is lazy. And when we teach it that the easiest way to have a contact with someone is to send the message, and we repeat it 20 times, then it's very difficult to have this, energy-consuming relationship that is offline. Oh. Doesn't work. So these are the difficult and easy solutions, but I really think that the important thing is that you can try to apply them, even the small ones and even the small steps, and you can try to start with yourself. Thank you.
Thank you. Thank you very much for this very condensed and full of information, full of tips presentation. I need to admit that watching content online while eating is apparently not only our problem. We are actually teaching our children from the very beginning to do it. We are trying to manipulate certain behaviors by showing them something of interest. So unfortunately, we need to learn that it's not good for us and it's not good for our children. So let me move smoothly to our next presenter, Servan Mouton, co-chair of the Commission on the Impact of Young People's Exposure to Screen from France.
Hello, thank you for inviting. No, that's not. Okay. Now it's okay. Perfect. Thank you for inviting me. Thank you for the organization of this event. I must say I'm quite moved today because it's not the first time I speak between a lot of people, but it's the first time I speak behind the European Commission. And maybe it's the best place to impulse big move to protection, to use of protection. So sorry if my English is not perfect and if I'm a bit stressed, but it's because I think this moment is very important and I feel a lot of pressure to represent France and my colleague who works with me on this commission to transmit the results of our work. So a lot has been said today or already said today. Maybe I will be quite quick on some subjects which has been detailed. So this was this commission. Maybe some of you had heard about it. Is a French commission. Mr. President Macron asked to work on screens and children use last year, and the report was published 1 year ago. And now things are going on again, maybe toward concretization, application of the recommendation we made, and we are going to talk about this. So just very quickly, of course, mental and physical health are closely linked, and screen use and misuse and overuse impacts both of them through sedentarity, sleep disturbances, lack of physical activity, but through vision impairment as well, myopia, retinal toxicity of blue light, inappropriate content, and maybe something we didn't talk a lot about today because it was not the main subject, but this technology has a non-negligible environmental impacts, and this has to be considered when thinking of the way we want to deploy it. So obviously, this is a systemic question. And the first thing we wanted to put in light in the report was that the first responsibility has to be put on industry, with attention economy and limitation to inappropriate content access that implied age control, which is not used today, are not efficient today. And then all the things have to be considered, but the first responsibility is industry, it's not user. Users are just paying the no regulation and the no ethical consideration of the industry. So then the institution has to push, how do we say, virtuous behaviors, parents, educators, and adolescents and children, of course. But again, the first responsibility is on industry and politics, who has to put a strict regulation toward industry, maybe working with them, but pushing them to be ethical. So for a systemic question, of course, there is a systemic answer, or systemic answers, because there are many of them. And we put the recommendations, there was 29 recommendations, maybe a small place for the 30th one. And there are in 6 axes. The first 2 ones are, logically, about regulation, digital film regulation. And the first thing is to ban the addictive behaviors, which are sorry, my English, I told you, but which are the economic model of all these big platforms, social media, but video games as well, and all this marketplace. They live, and they live really easily with this economic model, which is toxic by design. And this has to be banned. This is the role of the DSA, but the DSA has to be applied, fully applied, and it has to be reinforced as well, so that this content are banned. The second thing is to make efficient the age control. Just remind that social media are not allowed before 13, and at 13 is with parents' affordance, with the accord, I don't know, yeah. Well, parents must allow that, but in fact it is never asked, and it's 15 if not. So the age control is very important, but it raises democratic questions, because to have an age control, this means to have identity control, and who runs the identity control? It's about double identification, which raises it's technical consideration after, but this is not so easy to implement an ethic age control. So we've got to choose between protecting children and adolescents and protecting the anonymous use of internet, which are we are very important both, but what do we choose? It's almost an impossible choice today. Our point was, I'm very soon, it's too late. Of course, we've got to accompany children and adolescents in their use of internet, and we've got to protect them instead of controlling them. That's all about the safe internet place. I'll try to be further. As children and adolescents are not small adults, they're just different. They've got different needs, and they've got different vulnerability. So we think we should have a different attitude for children and adolescents than for adults, because numeric tools have impacts. They have impacts through the content, but through the tool itself, which is a physical tool, so it has physical impacts. That's why we are supporting the no screen under the age of 6. Screens are not recommended until the age of 6 from neurodevelopmental consideration and from vision consideration. I could answer a question if needed. The second thing is about smartphone and mobile phone use. We should have maybe a progressive access to this kind of tools, which are not they have impacts by their content and by the way they capture their attention. So we said no mobile phone before 11. At 11 is okay, but just a push button mobile phone. I don't know if it's the correct word, but just no internet mobile phone. At 13 it was okay for the smartphone, but without social media access, because we considered social media wouldn't be allowed before 15, and at 15 only ethical social media, which means today no social media at all, because they are not ethical. Then we went on what to do at school, and we agreed on banning, sorry, there could be a discussion, but banning mobile phone in primary and lower secondary school, which means for France until 15 years old. And after, it should be a subject of reflection, so that it's not, we don't know what to do, everyone do what he wants, just thinking that it's not a non-think topic, and maybe having a place where children, adolescents can connect, or maybe places where they can disconnect, but thinking of the impact of these tools at school. And I will go further. The two other ones are about education, people's education, so that they can navigate safely on internet and more widely with the numeric tools, but of course educating as well all the adults who are in contact with children and adolescents. I mean teachers, parents, and all the educators which are to be informed of the negative impact and of the recommendation algorithm impact and everything about the ecosystem, the numeric ecosystem. And we've got to think of at the place we want to give to this technology in our lives, considering the environmental impact as well, and considering the place we want to give to children and adolescents in the society as well. Maybe we'll just have to accept that children are noisy and moving all the time, and we don't have to put them a little tool in their hands so that they're just quiet and very silent, because it's not normal. A child is not silent and still. It's not a. It's a when he's okay. And it's the last one. I'm just totally over time. I'm so sorry. This has to be, of course, coordinate at a high level, because it has already been said many times today. This is a systemic question: education, health, but environmental consideration. Everything has to be put together to raise a systemic response to this systemic question. And I promised myself I will never finish an intervention before mentioning something about these numeric tools. We've got to think about our children and adolescent mental health, of course, in other countries. But please do not forget that this technology needs metals. And these metals come from far abroad countries, like Democratic Republic of Congo, where there are armed conflicts and massive violence, sexual violences for 20 years, 30 years almost now. And this technology can't exist without these metals. So when we consider the way we want to use it, we've got to consider the whole question, and this implied where it comes from and what is needed for this technology to exist. Thank you very much, and sorry for the time.
Thank you. Thank you. And I actually have a question. I think you touched upon something that is quite controversial. There are people very much in favor. There are people not that much in favor. So what kind of results did you get when you introduced the ban on smartphones at school? Were there protests from children or completely the opposite?
At the beginning of the year, in France, there has been the numeric pause. Or in fact, there is a law which was voted, I think I'm not sure of the date, I think it's 2018, so it's quite old, but it is not really applied everywhere, banning phone until 15 years old. And in September last year, the ministry asked pilot a school to really apply this, and the results are good, in fact, because the first thing that we hear is that teachers find that children are more efficient, they are more concentrated, because they are not always thinking of what they have in their bag, and maybe they can have something. Then they are not, how do they say, tricher, they're trying to find a solution in their bag when during the evaluation, and there are more relationship during all the time between classes, more activity and more discussion. So it's quite positive today.
Okay.
Yeah, really.
Okay, thank you.
And not so difficult to implement for the moment.
Thank you.
But to go, because this morning it was said that after school it could be worse when it's banned at school, but this comes with, this is supposed to come with other recommendation, which is no smartphone before 15 or 13 or 15, everything. This is but today there is just school pause.
Okay, thank you. Thank you very much. And this is actually the issue that I would ask Dominique Kutz from Growth Space Foundation to pick up, the ban on cell phones at schools.
Yeah, that's exactly what we are going to dive into. Sorry, I will go there because from this seat it's actually not possible to see all the slides. So very much thank you for introducing this topic, because also quite recently in January our NGO, which is Growth Space Foundation, has published a report on that. In Poland, there is no regulations coming from the Ministry of Education or the Ministry of Health regarding the school policies, and that is why as Growth Space we investigated how the policies are shaped in Poland in the schooling system, because in Poland every school can shape their own policy in statute, regulate the use of the cell phones, and we also asked the young people. I think what one of you has said, Madame Mouton, said that in order to make a safe cyberspace, you need no control, but also accompany the young people with them. So that is also the thing that we are talking about in the schooling system. So we investigated the representative number of the schools in all the regions of Poland. So there were 400 schools that we asked questions with the public information access. They were in all the regions of Poland. There were several types of the school. And what we have found is that actually the large majority of the schools in Poland regulate the use of the smartphones in the school communities. It is almost 90% of the school that has written information about it in the statute, but surprisingly, just slightly over 50%, so it was 51% actually to be precise, has implemented the ban of the schools in their school statutes. Whether it is working or not is a further question, but at least in the statute, it is written that the smartphones are not allowed in the certain cases. 12% of the schools introduced in the statutes the information about the so-called deposits. So the young people are leaving the smartphones at the entrance of the classroom in order to keep focused on the lessons. One third of all the investigated schools has tightened the regulation over past 3 years. So we see that even without the general regulations coming from the central institutions such as ministries, there is a trend to tighten the regulations of the smartphone use in the schools. That was a surprising data for us because actually, well, even despite we don't have some kind of nationwide regulations, the school communities decided to tighten their own school bans in certain communities. And whether it's working, we asked young people because that is the group, of course, that we are considering. And therefore, in February 2025, so it is just a recent thing, we organized as GrowSpace a public hearing with the city of Poznań. It was made with young people that expressed their point of view. I have to add that many of the young people were in favor of certain regulations and certain limitations as well, because they, of course, admitted that it has an impact on the health, of the mental health, of their well-being. But what you have said already about the control, it is not about imposing the ban or imposing the control, but to be authentic. So if we are imposing a ban, then the teachers also should not use the phones in their own classrooms. Or if we are talking about the ban or certain limitations, well, let's be concise about it and consult the policy with the young people to express it. Because if they are not aware why we are doing this, why we are leaving smartphones, why we are imposing some regulations in the school, then it is not efficient. So we had some pluses of minuses. That is, of course, overall thing that you can just read it here and the arguments that are in the public debate. But what I would like to add to this and to argue, it's about creating the smartphone-free policies or smartphone-free places, smartphone-free schools, together with young communities and young people, because that is actually what is showing up, that the regulations will be efficient if young people are aware why we are doing this. And that is why during the public hearing we raised also certain recommendations, certain policy recommendations for the municipalities and for the nationwide governments and European policies. Here you have a QR code, by the way, if you are interested in the whole report about the school policies, about the bans of the smartphones, you can scan it, of course, but it is in Polish. So sorry for that. We published only a Polish version. So unfortunately, it is the only version. But also from the public hearing, we collected recommendations coming up from young people about the cybersecurity, and certain recommendations were placed. Why is it important? Because when we are talking about the smartphones in school, let us not forget that certain phenomena are having a very big impact on young people's lives outside of the school. So if we are talking about harmful content, if we are talking about cyber violence, if we are talking about disinformation or the use of AI and its impact on our health and our mental health, it is also the case that it is happening outside of the school. So it is not only about having the ban during the school time, during the classes, during the lessons, but also being aware that the school will have to cope with the consequences of what will actually happen if the child is addicted to the smartphone. But outside of the school, if the child is watching harmful content on certain social media platforms outside of the school, and if the child is, for example, watching pato influencers outside of the school, and the school will need to cope with those consequences even if the ban is fully made during the classes. So actually these were also recommendations. I will not read it all because my time is already over. Just 2 closing sentences, sorry for that. That you can, of course, those recommendations are published also on our website. So if you want to dive in, of course, it is available. But what I want to add is that I think personally that we need more than only talking about the school ban of the smartphones. It is the debate that is coming over, but we also need further regulations in terms of social media use, in terms of the use of the AI technologies by young people, the misinformation, the pato influencer, especially in the health area that you are certainly aware of, than only focusing on that debate, because actually it is about protecting young people not only in the school time, but also building awareness about their future. Thank you very much. And
Thank
sorry
you.
for this.
Thank you. Well said. And I would only like to underline that this is another occasion that we are actually hearing that nothing without us, nothing about us without us, nothing about the children, adolescents, without their voice being present. Thank you. Thank you very much, Dominique, for that. Fatima Avil, Policy and Knowledge Officer at Mental Health Europe. Fatima, what is your take? What are your practical advices when it comes to this topic?
Yes, good afternoon, and thank you so much for the invitation. I'm really happy that the Polish presidency is focusing on this super important topic. And I'll be focusing on a couple of recommendations that we have put forward as Mental Health Europe in regards to digitalization and specifically on children and young people. I'll draw on some of the really fantastic points that were made in previous presentations, and also, of course, intersecting with what was already mentioned by my fellow speakers during this panel. So for those who aren't familiar, Mental Health Europe is a European umbrella organization. We have over 90 members in over 30 European countries, and Mental Health Europe is based in Brussels. And as an organization, we really argue for a psychosocial approach to mental health. So this is really the recognition that mental health is shaped by our various life events and factors, and socioeconomic factors are crucial when addressing mental health. So a holistic approach is essential when looking at the needs, which include, of course, factors that increase our likelihood of experiencing mental health risk factors, and also trying to identify and implement factors that increase our likelihood of experiencing mental health protective factors, which increase our overall well-being. So in this approach, it's actions in regards to mental health that we push for have to go beyond health. So mental health is something that's influenced by our wider environment, and so that needs to be reflected in the policies, actions, and frameworks that are put in place. And this is something that I already want to underscore in regards to digitalization, because I noted down a quote earlier that the internet is the new playground. And when we say and highlight this, we have to look at maybe why this is the case. And it's important to look at, for example, our, the barriers in society that are influencing the increased use of digital tools and social media, which has been brought up quite a lot. Just to give an example, I had a conversation with a mother who highlighted that for her, social media and handing over the phone was a lot easier in regards to her situation with, having many children and also the work-life balance, as well as concerns about, if you let your children, be outside in the playground, the physical playground, some of the concerns and dangers in terms of safety in the neighborhood and factors like that which come into play. So, when we talk about identifying challenges in regards to digitalization, we have to look at social factors which need to be addressed. Another example is overcrowding in households and how phones could be seen as a tool to, make life easier and also safer and more cohesion within the household. So these are some of the things that we should be having more conversations around. As an organization, we recently actually published a report on artificial intelligence in mental health care, which targets policymakers, service providers, and other stakeholders. And one thing that we did note is that when we talk about digitalization, we have to avoid the black and white attitudes and also look at the positive elements in the discourse to digital well-being. Otherwise, what we really do is we risk demonizing digital technologies and reinforcing prejudice, fears, and barriers to the development of digital competencies and the engagement of digital solutions. So while we have to note the risks, digital technologies also have the potential to further well-being rather than being a source of harm. And Lydia mentioned that it's here to stay, so we have to really deal with the issue at stake. And in regards to some factors, despite the huge potential of online services to connect people and enrich relationships, it can also have an adverse effect on young people who may withdraw and become more isolated. One thing I wanted to note in connection to this, and a challenge that we often identify when it comes to mental health, is that mental health, those that experience mental health problems and psychosocial disabilities, unfortunately, the societies that we live in reinforce exclusion. And when looking at this, it can encourage individuals to turn to sources of support and community, which is often highlighted in terms of being at an online social media platforms to build connections and connect with communities and like-minded individuals and also be a source of support. So when we look at solutions, we have to identify what we could do to really foster a more inclusive society and one that encourages for individuals to access their sources of community and support. And when looking at this, we have to also identify some of the barriers. So children, for example, might not be able to connect with other kids because of transport issues, a lack of accessibility, and also, in general, children not being outside. If everyone's playing in the digital playground, then where are the children in the physical world? So we have to look at that. Also, in terms of youth centers and societies and clubs, they are often requiring payments in many cases, which can also be another barrier. So I wanted to just highlight a few more points in terms of digitalization. And it's that there needs to be a co-creation in place. So children and young people need to be part of the solution. They need to be at the table as well as all relevant stakeholders. And this is important in regards to a point that was raised earlier, which is trust. When building frameworks in place for children and young people. So co-creation is essential, and also involving schools. So I'll stop here, but I wanted to briefly highlight the whole schools approach. So teachers already have a lot of strain and responsibilities. And when identifying mental health support and looking at solutions, we have to ensure that other community-based supports and frameworks are invited into the school environment, into the school placement, rather than actually placing the responsibilities on families and carers to find solutions for themselves. and also ensuring support for the supporters. So teachers and staff also should be trained and supported to better their mental health to foster a better learning environment. So finding community is something that I've stressed throughout my presentation, and I'll stop here, but I'm happy to answer any questions that you may have or would like to discuss anything further. Thank you.
Thank you. We still have two great presentations, so I will restrain myself from asking questions, and I will reserve that for the lunchtime. And I would like to welcome Cornelia Kiss, Head of Culture and Health at Culture Action Europe, that she's going to give a presentation on something that was completely difficult and unknown for me, and I'm a researcher in this field. So thank you very much, Cornelia.
Thank you very much, everybody. Before I begin, I'd just like you to make a bit of a rolling of your shoulders, please. Let's connect back. You can also wiggle a bit on your chairs, yeah? Just to wake you up, because I know I'm at the 7th presenter, so I want your full attention. Thank you. So my name is Cornelia Kish. I'm the co-author of the Culture for Health report, which some of you have in your bags. I only brought 50 of them, so sorry for the ones who don't have it, but I'm very happy to give you some. Basically, what I wanted to tell you is that Culture Action Europe is also based in Brussels. We have over 250 members in 35 countries. Many of them are actually cultural networks themselves. We are a cultural network, and by being in Brussels and having this wide membership base, we are advocating for better cultural policies, but also better policies that should include culture. And we've been talking about the integrated services, and education was mentioned, social services were mentioned, and health was mentioned. And actually, the cultural sector is also there to help this topic. So what I want to connect to some of the things that were mentioned earlier. I've heard, for example, in-person social connection. I've heard positive face-to-face interaction, human-centered approach. Well, these are all, there was also a call for alternatives to screen time. Well, actually, cultural activities are alternatives to screen time, and they are actually very beneficial. So what I actually mean, one way, when I say cultural activities, one way is the so-called receptive cultural activities when you go to the theater, for example. The other way is the active participative cultural activities, when you are actually engaging in, for example, what is very beneficial for youth is working with improvisative theater in a group setting, getting to know each other with your classmates in a totally different way. Those are all the tools that the cultural sector can offer. Just to say that the Culture for Health report is available on the cultureforhealth.eu website. And what I also want to highlight that we actually have a database of over 800 projects, which you can search, and if you type in their youth, you will find tons of projects which are giving these examples of alternatives to screen time. But now I thought, so let's give it a try. Yeah. Please look at this video, hopefully. No. What do I do to start the video? Green.
Engaging with the arts and culture can support our health and well-being. Until recently, research has mainly looked at the short-term impacts of the arts. But what about the long-term effects? Researchers from the Social Biobehavioral Research Group at UCL have examined data from over 320,000 participants all around the world, who have been tracked for decades as part of national cohort studies. Benefits begin in childhood, with engagement associated with stronger social development and fewer risky behaviours across adolescence. Adults who then engage in the arts have higher life satisfaction and a reduced risk over time of developing depression. These benefits extend to older adulthood, where we found protective associations with frailty, chronic pain, cognitive decline, and dementia as people age. These relationships hold even when accounting for factors such as people's socioeconomic status, medical history, and past arts engagement, highlighting the importance of the arts for public health. To learn more, visit sbbresearch.org.
Well, I thought I cannot say faster and better than this video, so that's why I included in my slides. And I'm trying to go further. Wonderful. Okay, so here you see some of the findings of the Culture for Health report. It is on the page 7. This is the most important part, let's say, other than the policy recommendations. Actually, the WHO in 2019 has published a report, What is the Evidence on Arts Contributing to Health and Well-being? And in the first column, you actually see the associations between culture and health. It actually is helping healthy living and health-promoting behaviors, better mental health conditions, and it's very engaging in the arts and culture, helps with neurodevelopmental and neurological disorders, for example, dementia, but also some other things. Also in depression, where it actually is useful is in the early action phase, and the recovery phase. And of course, there is also art therapy, which is a little bit different within the depression phase. We also looked at, we added to the WHO report also the idea of how culture is good for your subjective well-being. And the findings were that engaging in the arts and culture helps with self-expression, empowerment, increased social engagement, bonding, and inclusion. Think about how good that is actually for youth. I just highlighted the ones which are very relevant for this discussion. Engaging in the arts also increases empathy, confidence, and self-value, emotional regulation, finding of meaning. At this age, it's very important. But also cultural activities can help with community well-being, and I think this is where it can really, really help with certain interventions. It can help increasing social engagement, reducing isolation. So instead of being on your phone, why don't you actually engage with the help of an artist in a safe space and in a way that you are not told what to do, what is usually at schools, but rather also have your way of expressing yourself. And of course, it also helps with school-related well-being. So some of the examples here that were associations, for example, what we really have seen in the cultural sector consulting them is, of course, music, because they are very much into music. Music making is very, very helpful. Drama and storytelling, again, improvisative theater, with basically setting their rules are really very helpful. And dance and movement, because you're reconnecting to your bodies. That's exactly what you were doing when you were rolling your shoulders, yeah? Isn't it feeling better? And I must say that we always mention physical activity. There are some people who are sportsy people, that's great. But there are at least 50% of the people don't really like to do sports. But for example, dancing is an alternative form of moving as well. So please don't forget the cultural sector at this point. We have spent in workshops with more than 45 cultural practitioners really trying to get the essence of what works for youth. And this will very much, I think, connect to, I think it's Marta, what you were saying. So one thing is that we need a non-competitive and non-judgmental environment. This is, the artist called this safe space, where you basically start your workshop by, it's okay if you don't want to engage, but if you want to engage, please feel free to express however you'd like. There is no right or wrong. Imagine what the difference is versus school. But the other thing that we have found is that, of course, youth need to co-create the results. So it's not that the artists say that we are going to stage a theater piece, but rather really often in these improvisative theater workshops, it's the youth who are actually writing what the story should be. And there are very good training and facilitation skills that are needed for this, but the people are there. But also, it's very important to involve the youth in the co-creation of the process. How are we going to decide what music we are going to dance to? We discuss, what do you think what we should do? Let's vote, says one. Oh yeah, that's a good idea. So also a little bit facilitating that part of how you can co-create the process of getting there. And of course, it's very important that you give space for personal preferences. We can't force someone to paint if they are really not into it. But that's why I think giving a choice of various art intervention possibilities is really useful. So, as you were saying earlier, youth-led projects are very, very useful. And this is what you can do in a safe space. Another thing that I need to mention is if you want to change habits of young people, research shows that you have to have at least 8 encounters. So usually it's per week, for example. The idea would be, because I see I'm kind of out of time, and this is where policymaking comes in. What could be the answer? We have a local authority who actually makes people come together. Because otherwise by themselves they will probably not do. So do you really need a politician that believes in this? And the health sector could work together with the schools and the cultural sector. What I'm meaning, for example, the cultural organization within the local authority selects 4 artists from different disciplines who go to the school and do 2 or 3 such workshops because they need to get into it, but then bring it over to the cultural institutions later on, because I understand you can't do this during school time. But there are so many different ways to do this, and Edita is going to talk about this as well. It's called Arts and Prescription. I just want to tell you that actually policy-wise we are kind of close, because already the comprehensive approach to mental health mentions culture many times, but also there was an EU Council conclusion called Access to Culture from the cultural sector, which actually mentions culture-based social prescribing as well. And also on EU level, from the cultural sector side, but also the health ministries are involved. There is something which is called the Open Method of Coordination on Culture and Health, where EU member states, at least 20 of them, came together to see how the culture and the health sectors could work closer together. So, and they are coming out with a report around September 2025. These are just, so it says cultural prescribing projects, the access to culture. Regarding policy recommendations, I think the best is if you check the Culture for Health report, but I just want to say that we have looked at our own policy recommendations, and based on that we have established a platform called Culture and Health Platform. So in all these countries, including Poland, we have actually an organization that is actually working with artists working in the area of culture and health. And here I have a list of things that could happen on policy level. So what we really need here is actually specific calls for culture and health interventions, because otherwise they fall in between the cracks. It's neither culture nor health, and therefore it falls into the cracks. But also it's very important to allow for experimentation, failure and design, and have longer project duration to co-design with the health professional and the cultural professional, the whole system. I think I'll stop right there. You can see some of the websites that we are working on, and I'm very happy to answer some questions.
Thank you, Cornelia. I think the questions will be for the lunch period, but I'm absolutely impressed how organized everything is. It's not just an idea; it's already an idea put into action and plenty of evaluation. So congratulations and thank you. And last but not least, picking up with the same topic, Edyta Ruta from the Institute of Urban Culture, City of Ways from Poland.
Good afternoon. It's a great honor for me to speak about social prescribing for youth mental health today. As an organization, we develop culture and health program locally in Bielsko-Biała in Poland, nationally, but also as a member of EU Culture and Health platform. The photo you just have seen was from the last year international conference about culture for health and well-being. And we were really honored that WHO, but also European Commission joined us to talk about how culture can help with the mental health, also including young people. Why do we bring social prescribing here? Let me answer with two main reasons. First is because it answers the challenge that health care system is facing. The research says that 200,000 of consultations a day is dealing with non-medical issues. And it's even harder for young people to seek for support, to seek for places or people who can help. And here comes a social prescribing. Because social prescribing is empowering young people through connecting them with the services they need. And in the heart of social prescribing is this recognition that our health, it's not only shaped by medical treatment, but also through supportive relationships or meaningful activities. Let me show you a short movie explaining one example, because social prescribing is a broad model with variety of activities like sport, like nature-based activities, but also arts. And arts on prescription, this video will explain to you. This movie was made under arts on prescription in the Baltic Sea region with active participation from West Pomeranian region. And how do I play this? Next.
In a world where stress, depression, and anxiety are on the rise, a novel solution is emerging: arts on prescription. When we look around us, we see a lot of people struggling with feelings of isolation, loneliness, or hopelessness. But what if we told you your well-being can be improved by getting a prescription for creative activities? Arts on Prescription, or AOP for short, is a community-based intervention designed to improve the well-being of people through engagement in arts and culture. It has been tested in countries like the UK, USA, Australia, Denmark, and Sweden with promising results. One way to implement AOP programs is to bring together groups of about 10 individuals for 8 to 12 weeks of artistic or creative adventures. During these programs, participants dive into a world of creative group activities like shared reading, dancing, singing, and painting courses. It's a break from the struggles of their daily lives, a chance to let their creativity flow. By engaging in these artistic activities, participants enter a safe space that is free from expectations and societal pressure. The creative activities offer room for imagination, aesthetic and emotional expression, and relieve people from stress. Moreover, their self-esteem can soar to new heights, and they build social connections, fostering social engagement. This means that arts on prescription programs not only can unlock creative potential, but also have the possibility to enhance mental well-being and social interaction, ultimately leading to improved overall well-being. The most important benefit is the enjoyment and satisfaction that comes from engaging in creative activities, which contribute to a positive outlook on life. So remember, in a world filled with challenges, Arts on Prescription is painting a brighter and more colorful future for us all. Learn more about Arts on Prescription by visiting the links below or scanning the QR code.
And this is how this model really works, but we have to run. It's not a local initiative, it's a global movement, and there is researches showing that the arts has really transformative power. People who took part in this program, they say, young people, they say they feel less isolated, that it's easier for them to make decisions. They are more aware about their emotional life and many other good reasons to take part in arts activities. And some numbers. Social prescribing is operating already in 30 countries worldwide. In Europe, at least 18. In England, since 2019, when it has started, over 2 million people have benefited from this. The knowledge and the awareness of this program, this model is growing among the doctors, and there is some savings for system, $296 million each year if we use this model. So this is a very practical solution too. One word about Horizon Health. I wanted to mention this because Medical University from Wrocław is one of the 23 members participating in this program, and we really hope that this one will bring more data, that social prescribing can be adapted wider in Europe. And we cannot forget today about digital social prescribing. It has its opportunities and challenges, but here I would love to say that let's use it to reach more young people, but do not forget to propose them activities in a real life, but thanks to the mobile solutions as well. Between those, I would say the most important recommendation will be let's prepare EU youth social prescribing strategy with young people. And let's empower young people. Let's do it together because we have experienced today beautiful presentation from the girls. Let's find what matters to them, and this is how it works. Some references, especially connected to Thrive from last month. And let me quote Charlotte Osborne Ford, Chief Executive of National Academy for Social Prescribing. We should ask young people what matters to you, instead of, what's the matter with you? Thank you for your attention.
Thank you very much. We are a little bit past the time, so I will not summarize the whole panel. Please do come for the next session when we will summarize all of the panels. I would like to thank all of you to actually for being here and for sharing your experiences and taking the time from your busy schedules. And one more comment from very small comment.
I just forgot to tell there was a paper in the bag with a QR code to the synthesis of the report, and the my colleague in the has prepared it, and the report is in French on the Élysée website. It's supposed to be in English, an English version too, but I'm not sure it's online already, but it should be very quickly, so thank you very much.
Okay, okay, perfect. Thank you. Thank you again. Thank you very much. And let's have lunch. Thank you.
that our networking time was used very fruitfully. I hope so. Hope that you enjoyed your lunch also. I think that you can take your seats. Yes, you are very much welcomed.
I'm moving together with my targets.
So I think that we have all the panelists now. Okay, so good afternoon again. I think that we are ready to start the summary session. During this session, we will have two co-chairs, Ms. Ilona Kikbush, a member of the Global Preparedness Monitoring Board, adjunct professor at the Graduate Institute of International and Development Studies from Switzerland. Hello, Ivana. And Lydia Lazeri, Regional Advisor, Mental Health Flagship, WHO Regional Office for Europe. During this summary session, we would like to have a little feedback from the high-level panel and parallel sessions. So that's why we have our panelists, Mr. Antonio Parenti, who will present remarks from European Commission. Ms. Anna Depuka, the facilitator of the high-level panel. Ms. Magdalena Rowicka, moderator of parallel session A. Ms. Dorota Kleszczewska, moderator of parallel session B. And Mr. Maciej Pilecki, moderator of panel C. Over to you, Jess.
Thank you. Thank you very much, and we're delighted, Licia and I, to moderate this panel. We've discussed a little bit how to do this, and that's why, we've sort of put everyone in the middle and sort of framing you in the most literal sense of the word, because the really important thing is how we frame this agenda. And many of you have made suggestions for that. And the framing, of course, that you see from the background paper that was produced from WHO and many of the other speakers is a framing in the sense of public health action and public health responsibility, which, of course, includes intersectoral action, but also a framing in terms of well-being, a positive framing. We've heard a lot about the negative effects of the, in quotes, internet, the, in quotes, social media, the AI, etc. But the issue is really how we live our lives and how health is created in everyday life. And while this important discussion has come out of the mental health community because of some of the extreme consequences, we've heard about suicide, we've heard about depression, we've heard about so many of these things, the really worrisome thing, and I think this is what the young people told us, is really what it does to everyday life. In terms of anxiety, in terms of loneliness, in terms of am I good enough, in terms of comparison, all those kind of things. And therefore, I think bringing together this well-being, the public health, the mental health, and the digital discussion with that direction of well-being, some people call it digital well-being, is absolutely critical. And I think we heard a lot about that here today. And therefore, Licia and I thought, and I'll give the floor to Licia now, to start to hear from the working groups first. Please, Licia.
Thank you, Ilona. And I think what has not been said enough today is the role that Ilona personally has played in the conclusion of this work. This has started about 6 months ago, when the first discussion started and the design of this work, including the evidence review, the scoping review, the policy mapping, and then the development of the policy brief. And it has been a work that has required a lot of back and forth discussions, both in person and online. And I'm truly honored, Ilona, to have worked with you, also considering that I always looked up to you when you were chairing those those wonderful public health sessions here and there in important European fora. So, and with that, I hope as WHO we have been able to contribute to this path towards improving digital spaces for our young people in Europe. And there is a very clear leadership from the member states. Poland is the exemplary case for that. But certainly we heard from the European Commission that there is an intention to take this further forward. And we would like to hear that from Mr. Parenti, but not before we have heard from the moderators of the working group. So I'd like to go to Magdalena Rowicka. Is it Rowicka? Is it okay?
Perfect. That's perfect.
How do you say it in Polish? Rowicka?
It was perfect. Rowicka, perfect. Thank you.
Okay. That very masterfully moderated the panel A. So the floor is to you.
Thank you. Thank you very much. I actually prepared some visual aids to lead the summary, since the first panel focused, first of all, on just grasping on the most important highlights from the two reports that were launched today. But then we talked about very different approaches, very different good practices and strategies all over the Europe and probably all over the globe. So what I was trying to do is to navigate a little bit, to go step by step, and to start with the fact that I think we all agreed that technology is not a villain, at least not in 100%, right? And obviously today, later on, we will hear about positive aspects of technology. But even when we are talking about the negativity, there are voices of children, adolescents, young adults who are saying, well, actually technology saved me. This is a safe space for me, and I will not exchange it for anything. So essentially, we are trying to balance the benefits and the negative aspects and to promote or to assure the mitigation of risk factors that are arising from the use or abuse of technology. And what was quite important was that we need to have a systemic answer, the answer from the system to secure the rules, to secure the safety of the internet and the technology, to assure that the data is protected, and to introduce and to execute different safeguards. So one of the proposals is the Digital Service Act, and it would be great to see its implementation across the whole Europe. But essentially what we need is harmonization. So whatever we will actually develop, it should be pretty much similar across the Europe. And then I would love to move to the user. I'm a psychologist, so my background is psychological, so no wonder that there are at least 3 aspects of the user. But we've already heard during the general session about the digital hygiene and the fact that we need to also teach the children as well as the parents about the safe use of the technology, and digital hygiene seems to do that. One of those aspects could be the critical thinking, for example. Then we move to psychosocial skills or socio-emotional skills that are extremely important, and the report of OECD presented a handful of interventions that are actually promoting emotional and social mental health without touching that much the digital aspect. And finally, alternative activities, including culture. So thank you very much. Thank you very much for pointing this one out, to engage in different activities, including culture, and we have evidence-based for that, so absolutely great. And finally, the community, the parents, the educators, the caregivers. We need to, first of all, equip them with knowledge, with skills. We need to promote their role modeling to our children, but we also need to take care of them because they are also stressed out and they also engage in different activities that are not pro-developmental in order to deal with stress. So we need to offer also education for them. And just an overreaching goal, I would say, is that we need to have a round table to achieve all of that. We need to have the policymakers, we need to have the researchers, we need to have the mental health and health in general, but also we need to have the children and adolescents. We need to have their voices heard, and we need to tailor our answers and our strategies towards their needs. So we need to understand what they actually want. So thank you very much.
It was a very articulated and concise summary of an hour and a half of very, very rich discussions. It was impressive indeed to have 9 amazing speakers that could, and the wealth of their input. So thank you very much for so concisely.
Let's clap for that summary.
Yeah. Probably the audience was amazed and they were speechless. So I'm going on to introduce the second panel, Dorota Kleszczewska.
This is the challenge, yes, Kleszczewska. Very nicely, thank you.
Moderator of panel B.
Thank you. Very interesting discussion also, and we have from the beginning 2 perspectives. The first area, we were looking at the background. We go more into details of HBSC data that has been also presented at the opening. We had the PI of the study from Poland here among us as a panelist. So Dr. Anna Dzielska presented us more detailed perspective, and just a huge question mark as a Polish adolescents as a case study, because we are, or our children are at the highest negative ranks of many indicators. So this is a good question for us all, the expert and the policymaker from Poland. Why is like that, and what's going on that the trend is so negative according to mental health indicators, but also cyberbullying or body image perception. So this is like the question marks that we haven't, of course, answered yet, but for sure we will try to, and we will need to face. So we were looking at the data and trying to answer about vulnerable groups among the general populations. So we focus on 13 years old, we focus also on social media use of girls. And then we, in the second part, we went into the vulnerable groups from the society, because of course they need to stronger focus on us all, especially in a digital age. So we went through the minorities, LGBT minorities, and we had maybe more time spent also on the refugee children, as Polish society and the Ukrainian society is now in a, let's say, special moment. We are 3 years after war break. We have the adolescents who were remotely schooling for 3 years. So we need to be aware of that we remember the COVID focus that we all have on adolescents abroad, Europe and abroad all the world. And here we have the Ukrainian adolescents who are schooling for 3 years now. Of course, they have entered Polish schools from the September 2024, and this is also the challenge that they are facing, also according to the digital age, and we spent some time also discussing on that. And we have also very great case studies about intervention, educational projects, and I think main conclusion, because we have also the
two-perspective approach in the manner of experts, because we have the experts, of course, the part, and we have the youth engagement representatives, so adolescents from Półtusk school, very, very well prepared for the discussion, presenting their own insights and their own projects. And I think what was the very positive closing remarks, let's say, that they wanted to be engaged. They wanted to be engaged as a policy makers, a policy development support. They want to prepare educational intervention, and they want to act, let's say, actively, not only passively. So I think we need to take advantage of them and take advantage of this attitude and do it together with adolescents. And I think this is the main clue from this session.
Well, the main clue, as you in your terms, could be on paper, scientific paper. It was very rich, actually, and another very concise and rich answer. Thank you. You mentioned, I'll take you up on what you said at the beginning. We don't have all the answers, but I think we have found some answers now, but for sure we have asked the right questions in this session that can be taken further
That's for
forward.
sure.
Yeah, thank you. And another applaud for Group B and its moderator. And I have the pleasure now to, and that is my challenge now, to say the name. Maciej Pilecki? Pilecki? Pilecki, okay. Moderator of panel C. Yeah, Ilona, now I see.
Thank you very much. So I was quite astonished because during this hour and a half we found solutions. The outcome of our meeting was, I think, quite optimistic. So it means there is plenty of things that we can do to increase hygiene and using the internet, and also to use the modern technologies to the support of mental condition of children, adolescents, and the families. And there were some areas that I think that we agree that should be challenged, and that the solution should be found in these areas. So the first one is that the big tech should be forced to implement safety regulations. Because if in Poland we have 1 million children using the applications that they shouldn't use, it has to be done something that the children could be support in not doing that. And if we are not going to control this area, if we are not able to control these activities, any other ways of helping them and working with them will fail. The second thing is that when we talk about the solutions, usually we are quite delayed, because if we do the research, if we see a new activity of children and adolescents in the internet, it means that we are 5 to 7 years behind. So that we should ask the users, you should ask the children and adolescents to help us to understand what are the problems that they are dealing right now, and to help to solve these problems and to solve the problems in advance. So to make the market, the big tech market, in the way that they are not going to produce the problems anymore. Second thing that was kind of an agreement about was that we should have our own European social media, or at least that we should have our place, that the applications, that they are reliable, that the application that the children and adolescents and families and professionals can use can be found in one place, and that it will be the information, it is something that is measured, that the safety of the application was checked, and that it is safe to give the opportunity to the child or adolescent to use the application. So this was the second thing that we should do. The third one was that we shouldn't think about 2 words, but rather we should think about kind of a hybrid word, when the internet and the face-to-face relation are somehow connected. And there was a beautiful examples from the Kamiński Foundation, the Faces of Depression Foundation, and from the Copernicus Center from Poland, that they were talking about this, how the applications can increase, can bond children with the tutors, or can the experience from the physical exercise that could be used in making the applications. So that there is no anymore the situation that we give the children that the children are taking part in the internet, in the word that it is the application and the internet word, but this is somehow the connection between something which is real and unreal, and also we have to help them to move between these two aspects of their life. And the fourth thing, I think that due to the important for me as a psychiatrist and psychotherapist was that internet gives us also the possibility to get to the population that would not come to us. So that the people who are afraid to go out from homes, for the people who do not have money to travel to big centers, to the people who are isolated, for whom, for instance, the chat would be the beginning of a conversation with someone, and if we suggest them, or the family members would suggest them that they should go somewhere, this will fail, they will not go. But maybe they will contact someone, they contact the professional through the internet. And this is something that can be used, and what we learn from the COVID pandemic time, but also from the countries where this is long distances between the centers and there is not enough specialists to work with everybody everywhere, is that the internet, that the digital world would help in that. What is the biggest challenge? The challenge is how to move forward, because it seems that we know what to do, but we don't know what to do things that we know that we should do. Okay. And one thing, the last thing, that you know, I am child and adolescent psychiatrist and psychotherapist, and I work with children and adolescents for many, many years. And for us, people who do this job for years, being not alone in that, being together and having this opportunity and possibility to have other open minds, people who are involved, and to share this responsibility with us is something very important. So thank you very much.
Thank you very much. And we had, such rich feedback. One of the things that I noticed is that we can remember some of these things by saying all this is about the letter S. Because we clearly said we need a systemic approach. That came through everywhere, I think. We were very concerned about safety, and in the context of safety, also about regulation, but of course also forms of social safety, creating safe environments, and in that context another S, particularly schools, came to the forefront very much. There was much about the social in terms of the social interaction, the social environment, and of course the social in terms of vulnerability, social equity, etc. So again, there's a whole area there. And that the connection between all those is to sort of move forward in what you said, or I interpreted as a positive bridging of worlds, because so many of the younger generation do live in both worlds, and we need to see how both of these worlds are safe. And I think, of Jonathan Haidt's word that to some extent we are over-concerned about the safety of our children in the real world and under-concerned about the safety of our children in the virtual world. Now there's this other big S, which is solutions, which of course leads us to the Digital Service Act. I thought, that could sort of work. But this is what then does take me to Antonio Parenti from the European Commission. There's, a strong call for many, and particularly the young people also, that fantastic presentation, to say, look, we need speed. We need speed because technology is changing so quickly, but we also need speed because we are feeling the impact now. And therefore, I think, and we heard now in terms of solutions, we heard it needs regulation, and we even heard it needs European social media. So big challenges that are obviously also coming forward in a number of other ways because of economic and financial issues, given the present developments with the Trump administration. So how do you see what you heard here, Antonio? What will you take back to Brussels? Will you say, 2 years of discussing with the tech industry is perhaps, a little bit long? Or how do you think it should move forward?
Well, thank you. Great debate today, the one I managed to witness. I think that today is allowing me to bring back a few things to Brussels. The first is we do need this debate at European level. There's a lot of national debate, but it's time for a debate at European level. We are launching this, and this is one of the priorities of this Commission. So there is certainly an endeavor to do it and to complete this in a relatively short span of time. I'm always a very of saying what time it's going to take and how long it's going to take, because those type of things are complicated. But, and you talk about the letter S, I would move forward and talk the letter W. I think we need certainly a whole of Europe approach. It cannot be exclusively national type of solution. We have to really look at from a European perspective. I think we need a whole of society approach. We need to have on board the digital world, the companies, because in many respects we will also need their help. And I think we will have to engage them and need their help in precisely overcoming some of the concern which have emerged today, which is that technology is always faster than the government. And so we need to work with them. I'm not sure. I mean, I understand some of the solution that has been proposed. Some are fascinating. I don't know how fast and easy, how to be implemented, but certainly have to be discussed. Maybe the last W, we need a whole of government approach. This cannot be just a matter for health ministries. It has to go beyond that. It has to go through education, through the part of the government which deals with digital services in general. It has to go to also implementing agencies in the different member states, because it's a debate which, and this is the last, the last W, it will go back to a wall of society in the future. I said this morning in my presentation, the Commissioner was also saying, I mean, what we are talking about is the future of the future citizens. So we really need to be in all together in this, and at a certain point we will also have to discuss with other countries, because the intersection of what is being put on the social media, the internet, is not only European, but is also coming from other areas and other countries. So there is a need also to have a discussion at a certain point with other countries to advance this type of information, to advance this type of debate on a more global level. But first of all, let's start to do the job at our level, at European level. And I so therefore looking very much forward to the continuation of the debate and the launching of the debate in the EU.
Thank you very much for that. And that's, of course, very important if you are able to take this back to Brussels with all the W's. And, of course, also it's a European issue and it's a whole of Commission issue. And that is also something that a lot of directorates obviously are involved. I wanted to ask a follow-up question, Antonio, because you also mentioned this morning the inquiry, the European inquiry. Can you say a few more words about that, how that will be done? Who in the Commission is taking the lead? Is it Health that's taking the lead? I seem to remember that was in the mission letter. Could you just give us a little bit of a feel for that? Because many of the researchers here, I think, will be very interested in how that is being done.
Well, we are working on putting the flesh in the bone of what was in the letter of Commissioner Varela. He reminded it this morning. The lead will most likely to be a co-lead at the end of the day between us and DG Connect, because it's the other DG which is highly involved into this. We want to have a serious, grounded debate on the many facets that the screen time implication have on people, especially the youth. So I would imagine, I mean, we are discussing at the moment various solutions, but we will want to have a solid basis on which be able to engage, especially with stakeholders and especially with the youth. So there will be a preparatory phase which will follow then a proper debate. This is why also I was a little bit wary of talking about times, because of course you have to follow a number of European specific type of regulation that regulate indeed this type of activities. But I would expect that towards the end of this year, there will be a very strong acceleration on the work, and then a very strong debate in the next couple of years on this.
Thank you very much, and thank you also for highlighting something that was really important, I think, in all discussions here. And of course, the organizers also, by inviting the young people, made that point very clearly, that this has to be discussed with young people. They need to have a voice in it, they need to participate. And you just reconfirmed that again, which I believe is very important. Now, let's go to Anna and get your view, Anna. You chaired the opening panel, you lived through the conference, you heard the reports now from the 3 working groups. As you reflect on that, can you give us some of your impressions, the kind of priorities you see, what maybe is the major challenge you will hope to be able to take forward, and perhaps you even see something that you feel is still a gap that we're not considering enough? Would you share that with us?
Thank you very much. I thought I'm going to have an easier task because you all heard the high-level panel, so I'm not going to summarize it. But yeah, I can see that's a challenge. First thing, I would like to mention that we still need both action because just strong political commitment and advocacy is still needed. As I was entering different panels, but also different conferences during our presidency, I can see we're still in some information bubbles and there are still some gaps, as you've noticed. And we could see that during the morning panel, because when we were discussing, it was more like on a professional level, and then our girls came, and their presentation was totally different. I felt like we are missing something still after their presentation. It was strong. And then I thought, as a clinician, psychiatrist, I don't have to be so, I would say, delicate. I don't have to be a politician. I'm a clinician, and I can just be in my area and show the important context of the impact on mental health, and that we do know that it's harmful in so many areas. And even though we see really huge advantage of modern technologies. For example, right now you can see I just have a little facility with me. In the morning I had sheets of paper that I was just preparing to the panel, and I had so many questions, and then I just put all my notes to the AI. I won't say which one. And it summarized the whole panels for me just in like 15 seconds. So yeah, we're going to use it, but as adults with mature personality, with a critical mind, and with the knowledge that we've gathered before, we can use it as a tool. But we still have to say that strong literacy and well-equipped child and adolescent development is needed. Otherwise, they're not going to use it the way I did like a few minutes ago. They're going to have like really strong harmful impact on their health. And that's why I'm so happy that we've gathered so many people around here, because in this high-level panel, I saw there is a strong commitment and so many involvement, and we've gathered those different contexts. But if there's not going to be a strong leader, and Europe as a leader, to actually deal, and that's the challenge, with this industry that has enormous amount of money behind them, and we're not going to address that as a researchers and clinicians, we don't have such an impact behind us. So we need politicians to do that. Otherwise, we're going to fail, because our young society, they're not going to use the modern technologies as we can use it as healthy, mature adults. So this is what actually I missed, that we need to focus on a certain groups and development and introducing the modern technologies. It's so obvious for everyone that we're not going to actually give to our kids key to our car and we'll say, just drive, or we're not going to give them alcohol. And it's still not so obvious that we cannot give them a smartphone when they're a year and a half. So I hope, I don't have to summarize the high-level panel, but I can ask and be here, because there's no our young colleagues with us, as their voice, and also as Maciek said, as a clinicians, and as a child and adolescent psychiatrist as well, we're not going to have enough resources, and we shouldn't have, because we have to place the intervention early. And if we're not going to do this, you're always going to hear there is a huge waiting list, and there's not enough psychiatrists, psychologists, and we'll have to use the e-service, but we have other solutions than using e-service. We can set up the intervention early, and that's why I would say once again, strong political commitment and advocacy for this area is still needed.
Thank you very much, Anna, and thank you also for drawing attention again to the larger environment. We've become used to now, we've had to, over the last couple of years, to take geopolitics more into our considerations, particularly as Europeans. But linked to that geopolitics is what some people, people speak of a new world order, but some say one of the key components of that new world order is actually the new technological order, which is to some extent then a question of competition between US-type systems and Chinese systems. And there are all kinds of discussions, and this goes back to Working Group C around the European social media, European internet. It refers to data sovereignty. If you ask a gap that I might have seen, but it might have taken us too far, some people mentioned it, is really what happens with the data, and who owns the data, and who makes money off the data, and why that money is not taxed, and why those data are not shared. In our program, we speak about data solidarity and the need to develop new ways to use and apply data and share data. There are different words for that. So I think that is definitely an area that we will also have to take forward, because the young people, I think, said, data is the new oil, but the the olive oil of data, the really expensive, really worthwhile data are health data. And I think, that's something we health people have to think more about. And health data are not only those from the hospitals, they are the everyday fitness data, what you eat, beauty stuff, and everything else. So I believe that's something we will need to take forward. And of course, the European Commission is looking at very carefully in terms of data ownership, data sovereignty. And many people say we'll end up probably with 5 internets, not one global one. And that's not necessarily a good perspective if we can't communicate anymore. But Lydia, maybe I can come back to you, maybe not as a moderator. Can I challenge you a bit as WHO? You've brought so much input, and we've heard many important things that WHO is also hoping to take forward. Are you willing, or would it need to be one of the other colleagues here to just say a few words how this discussion was important for the World Health Organization and your work?
I mentioned a bit in the beginning when I was given the floor at the parallel session A that it's very timely because we have, and Natasha, you more than I, because you also meet the member states in a capacity that goes beyond mental health, and how much this comes on our table, the request from member states to support them with guidance on how to deal with those challenges. And the challenge is twofold. First of all, systems that are more and more prone to data hack and privacy breach, but also the very concrete impact on the mental health and well-being of our young people, but also not necessarily young people. We are focusing on the young people, but what about women and eating disorders? What about impossible beauty standards that are drawing a lot of, and not only beauty for women, but also bodybuilding, etc. So the whole of the population is actually exposed to vulnerabilities because of standards that are so much permeating private lives that would never be believed until 10 years ago. So in a way, the Polish presidency's intention to politically elevate this into the European scene is much welcome and much timely. Of course, probably Natasha will say something more vis-à-vis the interface with member states. But as a mental health, now I'm talking with my mental health vest. I think what is, we talked about the S's, the 4 S's, we talk about the 3 W's, and we have 1 Y here, that is youth. Youth participation. I think it was mentioned, everybody that took the floor here, but also across the sessions, talk about the youth participation. And I want to say something here that we need to stop and evaluate and truly value and cherish. For us in mental health, participation of persons with lived experience is not a given. There is a lot of stigma, prejudices, myths against and around people who live with a mental health condition. So every time we talk about inclusive participation, we talk about co-creation, there is a lot of resistance, not in paper. You never have a letter from a government or from a professional saying, I don't want a person with mental health illness be in the same panel. But there are all the other ways that demonstrate a lot of stigma and a lot of fear and prejudice and misunderstanding around. While the participation of young people here, it is probably paving the way to once for all have no questioning from now on why it's important that people for whom services and policies are designed should be around the table. Because young people will not accept the resistances of policymakers and of professionals. While other people with mental health conditions, their parents would be more hesitant to push back. Not young people. And I think with this, what we witnessed here today, it's probably bringing us to the point of no return for a meaningful participation of those for whom policies and services are designed.
Thank you very much, and thank you for putting that focus again, which is so critical. We do actually have a few minutes, which I've just checked, for some comments or questions from the floor. So is there something somebody wants to underline, highlight something that was particularly important for them at this meeting, something they will take back, a challenge maybe to any of the people here on the podium, something if you were in the working groups that maybe didn't get the attention you think it should, who knows? So please raise your hand if you would like to contribute something. Here already is, okay. All right, so there's a lady there and then in front here, please. Yes, thank you.
Thank you for a great panel. Katarzyna Szymilewicz from Panopticon Foundation. We are part of European Digital Right and a number of movements who worked on Digital Services Act, mentioned a couple of times on the panel. The challenge I see is that with this quite powerful law and instruments we have for the European Commission, the challenge is that it's much easier for the EU to say the don'ts rather than the do's. And if we move towards good practices and recommendations on how to solve these problems, which I hear we all do, the question is how can the EU, the Commission, move from the don'ts to the do's in their dialogue with large online platforms. That's especially the question to the Commission representative. Is there a vehicle we can all use for this? Because so far when we address the Commission as organizations proposing the good practices, we heard, no, there is really nothing we can do as the Commission to force companies to change practices from the evil that are well described to the good, which we are more and more able to describe, but nobody is listening on the other side. So how can we work with the good practices, forcing them rather than waiting for industry to play along? Thank you.
Thank you. I'm collecting a couple and then maybe we can get some responses. There's a lady up front here, please. And don't be too long because then more people can say something.
No, I'll be very short. Nastasia Griffioen, I'm from the Trimbos Institute and the Games Promotion Mental Health Lab in the Netherlands. I was really happy as a researcher in the field of social media and youth well-being myself for the past 10 years to see such a nuanced perspective today. I wanted to add to that that maybe, we're looking at technologies as having mostly a negative impact, or that's at least what the worry is about, but I would like to add that there's also a lot of ways in which we can design digital tech, games for instance, but also online social experiences with youth, obviously, so that they can support flourishing. And I think we haven't heard a lot about that today yet, but there's a huge potential there. And that also makes me extra hopeful. So I wanted to add that, yes.
Thank you so much. The gentleman back there. You have to do a lot of walking. Anyone on that side afterwards? Okay, good.
Thank you. Good afternoon. Professor Paul Barish. I'm here on behalf of ASPER, the Association of Schools of Public Health. Fantastic meeting. I'd love to hear more from the panel about inviting health services researchers, implementation scientists, and human factors experts. I haven't heard enough about those domains. They're central for making hospitals and clinics safer and higher reliable. I think they have a lot to say about why other apps have failed, and other interventions have failed, and more importantly, the role of the environment around the technologies to enable and allow the interventions to work. So I'd love to hear more about that in order to verify the efficacy and the usability of these interventions. Thank you.
Thank you. And there was, well, on your way, yes, let's take this one and then move over here.
Yes, thank you. My name is Stefan Bogusławski. I work for the National Institute of Public Health in Warsaw, and thank you very much for this great meeting and great panels, great discussions. I have a question, actually, a kind of comment. We talked, at least we saw the examples of the new tools which are very profoundly interfering with the human psychology developed using IT means, AI, for example. And these tools are usually developed by public sector or by NGOs, while I think the industry will probably, using their resources, will take this lead and they will develop even more efficient and more profoundly interfering tools. Therefore, I would eventually consider talking about a kind of health technology assessment on the European level that could, at least in various ways, we do not talk about the reimbursement, of course, but by a kind of proof of concept, proof of safety for this kind of tools to be implemented on the market. Thank you.
Thank you for that. And there's somebody over here, please. There have been suggestions that also WHO should get involved in this kind of HTA, and that is something that is already also being discussed as an important thing. Some of it, think of what National Institutes of Health have been involved in, is quality assessment and quality assurance. But that's only a very, very first step, given the speed of change that was commented on. Please go ahead.
Yeah, thank you. Servan Mouton from France.
Can you stand up?
Sorry.
It's easier for everyone.
Sorry. Servan Mouton, co-chair of French Commission working on screens and children. Wanted to ask if there would be in coming months around the table all the stakeholders, including the one questioning on environmental impacts and humanitarian impacts of this technology, going to materials, energy, water, and everything needed for this technology, which, to our point, are to be considered because they are linked to One Health, the concept, and mental health and physical health. Thank you.
Thank you. An even broader whole of government issue here, but of course the energy issue is something that is increasingly concerning. Let's go to the panel, and I think, Antonio, you were asked a number of things if you want to get started.
Yeah, let me try to be to give a whole of an answer to what has been asked. Moving from the don'ts to the do's. I mean, to a large extent, they are the very same face, in the sense that when we specify, like in the Digital Services Act, what cannot be done in the internet, means that we are also promoting what you should be doing in the internet. Of course, you tend to have an easier approach with forbidding certain things and possibly put a penalty in the fact that you do certain things you shouldn't be doing. I mean, there are ample examples in every type of legal system in that sense. For us, what is going to be important now, and that is one of the tasks of the discussion that we are having, or we want to have, is indeed to define what are the type of policies that should be implemented. Now, we have left to see what is the result of that debate, what are the type of policies that are suggested, and what type of format those policies should be then taken, and that I'm sure will be a lot of do's. Then the question will arise on how to implement those do's. But I think we need to take a step at a time on this and try to define first what we would like to see. But to a large extent, as European citizens already today, between the health data space, the DSA, we are very much protected or on the path to be protected in comparison to many other countries. Of course, the world is, and Europe is not perfect in that respect, but certainly we are much more advanced than in other places in the world. A lot of these things, of course, have, and I come to the second, to the other question, I think, on how to give a sort of imprimatur, whether a product is good or not for health in the digital sphere or in the screen. Not an easy things to do. We're going back to it. To me, reminds when at a certain point, for example, a certain type of products were introduced in the market where they were branded as coming from a sustainable source. Those products were often certified by the producer, and at a certain point we started to have certification across Europe that was a fair trade product, for example. I think that this will develop over time also in this type of initiatives. It will be easier, and I think there will be more and more, because the quotients of internet, widely spoken, or social media being a problem for the young people is something which, in a room like this, is evident. In the wider world, is still being created. So I think in due course we will see more of these initiatives, and possibly a development in the future is not to be excluded. Did I forget anything?
I think those were the major ones that concerned you. I was going to ask if anyone else on the panel wanted to respond to the kind of issues raised, maybe also around, involving other types of professionals, etc., in the health sphere. Please go ahead. Yeah.
So what we know from the prevention program is that some prevention programs can cause harm. So we know it from some suicidal prevention program or eating disorder prevention program. And this is a question also about the apps, the mental health apps, if they are helping or not. I remember some of my patients coming to the office and telling me that they are not doing the self-cuts for 35 days or 322 days. And I was quite astonished, how do they collect this knowledge about the exact counting of the days they are not doing the self-harm. So they had the apps that they were counting for them. And the question is, if this promoting not harming themselves, or if they change from 300 days into the 0 day, it would be a risk factor, for instance, for the suicidal attempt. And I think that what we didn't talk much about is that we also should change the way we think about the research. So it means that usually we think about the research as a very careful collection of a small data and interpretation of the small data. And we can learn a lot about things we are talking today about. doing the analysis of a big data and using the artificial intelligence to do this kind of the analysis. So I think that is also something that we should adapt and we can change regarding the way we do science. Thank you.
Thank you very much. And one last comment. Yes, please go ahead, Magdalena.
Last one. Actually, I think competent, or I hope I'm competent only in the first question. So how to move from don'ts to do's. And I think, well, from my perspective, this needs more research. It's a little bit easier for us to answer the question what we should not be doing, and it's more difficult, and it requires more responsibility on our side to say what we should be doing. And myself, with my research, we actually at the very beginning said, don't do this, instead do something else before we actually did research. And after we did the research, it turned out, no, that's also the no-go. So in order to move from don'ts to do's, for me, the answer lies, among others, in research.
Just maybe to refer to that, because on the other hand, we know what to do. Yes, for instance, when we are talking about the 13 years old, yes, and the children under this age, they shouldn't be in the net. Yes, this is illegal. They are bound for that, and we know from the research that they are there. So the question is, if we have the law that is existing, why do we not implement it, or how to I don't know, those who obey that, or how to change the technology this way that we will exclude the youngest children from the net. This is only the question, and also the maybe call to action.
Thank you very much. We have been urged to be very punctual, which we will be or are. And I want to thank you very much for your contribution, and particularly the last contribution, which also links a little bit to what we heard from France, that in some countries they were laws, but nobody took them quite that seriously because society hadn't really realized how important the problem is. And I think we are clearly seeing a shift here, and the conference showed that. At our last conference, and I was talking with the Deputy Minister who will speak to you in a minute, I gave also an example that might make us wake up. And as we were working on, the regulation of digital for young people, I said we need to take up the rubber duck challenge. And it's a rubber duck challenge? Well, if you look at how many regulations, safety regulations exist for rubber ducks so that they don't harm children, and you compare that with the dearth of regulation in relation to digital and children, then you can be really shocked. Now, you might think there's too many regulations around rubber ducks, but on the whole, I think that's a very helpful comparison that, particularly now you have all these shops with all these millions of rubber ducks. But, and you have fined quite significantly if your rubber duck doesn't comply to the rules that exist in import and export and everything else. So that's something maybe to think about in terms of a comparison. And the last thing I'd like to leave with you is a science fiction notion. The young people and many other people said the digital will always be with us. Now, I don't know how many of you have seen Dune or have read Dune. Well, one of the things that led to Dune and everything that happens is that there was a war. There was a war, and remember what the young people said? There was a war between the humans and the machines. Actually, in that case, the humans won. And it was a really bad war. Maybe we can win a little bit earlier and avoid that big war. So thank you very much. Thank you to everyone here. And thank you to Poland for a fantastic conference. And I believe the Deputy Minister will speak in a minute. Over to you.
Yes, thank you very much. But dear panelists, please stay one more second at the stage, because we would like to equip you for your further journey, not only to your way home, but also with the knowledge about mental health of youth dedicated to adults. So we have some backpacks for you from one of our NGOs. Thank you. Thank you very much again. And now it's time to close our conference. So I invite Ms. Katarzyna Kacperczyk, Deputy Minister of Health, to final remarks.
Thank you very much. Again, ladies and gentlemen, distinguished guests, dear colleagues, thank you very much for being with us today, for excellent discussions, for your engagement, for your passion to the topic. Many thanks to Ilona Kirk-Bush for the story about the rubber duck. I think it might sound funny, but in fact it's very much appealing to everyone, and we very much appreciate this comparison during our first conference in January this year on this issue. We know exactly that we have a lot of bureaucratic regulations pertaining to safety of our children, but when it comes to digital sphere, we don't really have much regulations, much measures to protect our children. So again, Ilona, thank you very much for bringing it up during this conference. Let me also thank very much the Jagiellonian University for hosting us here, and also to all professors who are doing research in mental health for joining us for this conference. Many thanks to our partners, to the European Commission, DG Sante, but also to other DGs who supported us, to WHO, for excellent policy brief, for you to join us today, for excellent presentations, participation, and also for supporting us all the way also during our presidency. Many thanks to OECD, UNICEF, and also all the non-governmental governmental and non-governmental organizations who joined us today. Especially, thank you very much for today, but also for everything you are doing every single day to protect our children and to promote the significance of the topic. We know that we gather today to discuss, to collect, to promote what we are doing, but it's not only today, it's everyday hard work of every one of you gathered today. So many thanks on behalf of the Ministry of Health, Minister Leszczyn, and particularly myself for everything you are doing for children. And we had an excellent discussions, both during our plenary sessions, but also during the parallel smaller session when we have discussed among experts, but also with participation also of young people, both from Gdynia, but also from the high school from Półtusk. So we think that and hope that it will be a good practice also implemented in member states, but especially in the European Union, in WHO, to bring the young generation to the table to discuss the possible solutions and needs we need to address. And of course that new media, social media, digital world offers a lot of opportunities. We have discussed it today as well, but obviously we have also a lot of challenges and threats we need to to address. So we have to find balance how to use it in a smart, positive way, and at the same time minimize the risk they bring with them. So a lot of excellent proposals, recommendations. We hope we are, as a presidency and also as all the member states, also as the Commission, we are equipped with excellent solutions, tools. We need to bring it forward, and we promise we will after our presidency will come to the end. So we will stay engaged in this topic and work closely both with member states and the European Commission as well. And I'm also honored that as a Polish government, as a Polish Ministry of Health, we can bring the Council conclusion on this issue. You know that there have been a lot of activities, efforts, in fact, conclusions also implemented at the European Union on mental health. So we very much appreciate it, and also our work on the Polish presidency conclusions have taken stock and be based on many reports by inter alia, European Commission, WHO, and other organizations, but also on previous conclusions on mental health, which have been adopted by ministers. And we are happy that we can bring this issue, this challenge forward, and also put this dimension and more focus on children and young people, and also in the context of digital age. So we hope the purpose of the conclusion we will adopt hopefully on June 20th. Then they will aim at promoting digital hygiene and screen-free alternatives for young children. Also protecting minors from addictive design and harmful content. We have been talking about it also today. On implementing the targeted digital literacy program, strengthening cooperation in mental health in this area among different stakeholders. We advocate and promote also establishing of young advisory councils to the Commission, to also within the member states. And also there is a strong call in the conclusion to the industry, to the digital platforms owners on implementing safety solutions, ethical standards, and to cooperate with both European institutions and also with member states to protect our children. And last but not least, there is also a strong call in the conclusions on putting the mental health of children and young generation first as a priority, and the second thing as a cross-cutting issue across different policies and solutions we have already in place. We have discussed today about the Digital Services Act, and there have been a lot of voices underlining that we have already a lot of regulations in place about the regulating safety in internet and access, etc. But we need more focus on protecting mental health of children. That's why also in our conclusions we advocate then, whereas the Commission will evaluate the DSA, then it should take focus also on mental health of children and young generation, meaning evaluating existing digital act regulating the digital world also in the context of mental health and impact of the regulations they have on the mental health of children and young generation. And I hope that it will be a normal and usual practice in the future to evaluate all sectorial policies against the health. So this is also our purpose. And yeah, I will finish here. So again, thank you to everyone. And I need to use this opportunity also to thank a lot the team from the Ministry of Health for organizing this excellent event. And of course, there are a lot of experts who have been involved from the Ministry, the Department of Public Health and Department of International Cooperation in designing and preparing and organizing and in everything related to this conference. I need to mention two people, Kasia Drążek-Laskowska and Kuba Senkowski. Maybe you can stand up. Everybody knows you, but many thanks to you and to your teams for organizing so beautifully everything and putting everything together. It's the whole credit goes to you. So thank you very much again. We hope that this another conference was another step in contributing to improving the mental health of children and young generation. And I hope also this is not a last meeting we gathered together, and we will have a lot of additional opportunities to discuss this issue and to take concrete actions. Again, thank you very much for joining us today.
So it's maybe up to me to finally say something and take a place on stage. Dear Minister, it's not usual to have a minister both at the opening, at the end of a conference, and that's what we are grateful for.
Thank you very much. I have to tell you that this is my favorite priority. I brought it, this priority. I mean, by saying favorite one, it means that it's very important. So we brought it to the EU agenda, to the presidency agenda, and we hope it will help our children.
Thank you very much, Madam Minister. You know that all this positive attitude has also a very positive impact on our mental health as the civil servants, so thank you again. Dear guests, it's time to the end. So thank you all for all participants for being with us today. Thank you for all the speakers, panelists, and listeners. I think that it was really important day on the subject of mental health of children and adolescents. To those who are going back home, I wish a very safe journey. To those who are staying in Krakow, I would like to invite you again to the building of Auditorium Maximum, also for tomorrow, for the intersectoral event of the Polish presidency, named Health Security, Challenges, Innovations and Future. So you are very much welcomed to stay also for tomorrow. See you.